All right, we are recording. This is Mr. McCarthy. Welcome to RT210 Respiratory Care and Therapeutics. This is the class. Question? Cut your mics off. Everybody, cut your mic off, or just mute yourself. All right, so Lori, I need you to mute yourself, please. Nah, well, it might be. I don't know. It's different. On yours, it looks a little different. But that's fine. I thought you were somebody here and I didn't pay attention. Okay. All right. So this is Respiratory Care Therapeutics. It's a very arduous course. It's very fast-paced. Like they say, you're not in Kansas anymore. You're not in Gen Eds anymore. Okay. I'm really pleased that those that maybe have gotten on the dean's list and all these different accolades. But that doesn't carry over into respiratory. Okay, so don't be upset if you don't do as well as you thought you would have done on a certain test and let that bog you down or put you in a feeling or depression, because this is very hard. It's a very hard course, but it's very rewarding. All right, our profession is in high demand right now with COVID-19. I'm staying here doing this teaching, but I could be making $13,000 every week right now, okay, if I was to leave. But I have a wife, I have 8 children, I have insurance. I can't just up and leave. But for those who are fresh out of school, those who are been in the game for a year or so, they're dipping, okay? They're at the hospitals. We're losing therapists hand over foot because they're going to travel, chasing the money. And I understand that. I like and appreciate that respiratory is being utilized like it is. It's being such high demand. It makes me feel good because that's my profession. Okay. And I won't put just anything out there in my profession. Okay. This is an associate's degree program. It's not a certificate, not a diploma. This is a degree. You are going into a profession. So we expect you to carry yourself as professionals. All right. So let's go get into it. The first unit you'll see, I'm going to share my screen and show you how it's going to flow. Everybody has was emailed a homework packet. If you didn't have it or get it, I have some here. Okay. This is how it looks. Homework 210 A through J. Now, actually, J is not in there, so don't worry about that. That'd be the last one anyway, because they changed some things out of J that the NBRC, which is the National Board of Respiratory Care, they took some things out that they don't test over anymore. So therefore, we took it out of our curriculum. So don't worry about J. You'll notice that there may be 1, 2, 3, 4, 5. B may have 1, 2, 3. C may have 1, 2, 3, 4, right? You don't have to go ahead and try to turn them all in. You don't do that. Okay, every day that I lecture, at the end of the day, I'm gonna say, okay, guys, do number 5 today, or do homework 210A number 3, and that will be due by midnight. That will count a part of your homework grade and your attendance. Okay, even if you're in this room, if you don't do the homework by midnight, you're absent. Okay, they have to have a way to prove that you were here. Okay, so that's how I do it. So for instance, homework number 3 for RT210A looks like this. You're going to look at this. You're going to answer these questions on a separate sheet of paper, of course, and you would simply take a picture of it and upload it. Okay, simple as that. That's your homework. Now, like I said, don't try to go ahead. I want to do all my homeworks because a lot of the information comes as I lecture. You may not know some of the stuff you're trying to do 4 and 5 on the first day, and you don't know it. Okay. It's not going to be, I don't grade it for accuracy per se. I usually just try to get it and make sure you did it for your attendance. But if I check every now and then, I will do a forensic check to see if people are just putting anything. Okay. You know that's not the answer. You're just putting something just to get credit for that day. I wasn't there. I I didn't watch the video. I didn't feel like doing school today. I looked at the end of the day, I saw his little homework. I just wrote anything and turned it in, got my attendance. So when I start seeing that, then I start grading everybody's forensically, okay? And so everybody has a 100% on your homework right now, okay? Everybody has 100% already factored into your grade for all of the homeworks. So it's when you don't do one is when it starts to take away. So for instance, let me share my screen with the syllabus. This is the syllabus. Can y'all see it? Everybody see it? Okay. This is the syllabus. Notice how RT210A has homeworks 1, 2, 3, 4, and 5. So if there's 5 of the homeworks, then each one of these homeworks is worth 20 points. You already got 100 for it. Okay. You already have 100 for it. But say you don't do 1 and 2. Well, that's 40 points off. That means the most you can get for 210A's homework would be a 60%. So it drop you from 100% to 60% on that module's homework, okay? And so that's how it's going to flow. I will assign homework every day that I want you to do homework. You don't have to expect to have done something, or there's 2, 3 pages of stuff you had to do, you should have known it, that type of thing. I'm going to give you the assignment every day, okay? It's going to be recorded. So say at the end of the day, you weren't able to log in from 1 to 6 live. You had to work or whatever the issue is. When you got home, you need to turn it on, watch it, and take notes with the note-taking guide as I go along with the lecture. And at the end of the day, you need to make sure you do that homework. So it starts out, we're going over the syllabus right quick. Today's the 4th. We're going to start talking about measurements, terminology, and ethics. These are the chapters in Egan's that they want you to go through. The chapters in the Egan's book, which when you get if you don't have your book, this is the Egan's book here. Can y'all see this on your, even though I'm sharing my screen, you can see me doing, okay. This is the Egan's book. Very, very important that you have that book at every day. You're either watching the syllabus, the lecture, or in class. Always have at least that book for sure. All right, because I go back and forth to the book, may ask you to read part of the book. Very, very important that you have your Egan's book. That's where a lot of information is going to come from. Just because I lecture and you take a note-taking guide, it may be 4 or 5 questions on the test that's not even in the lecture, but in the book. All right, so it's very important that you take notes and you read, okay? You got to get yourself, because I hate reading, but you got to get yourself in a position where you're ready to do that so you can get this, okay? 50 weeks go by, you'll be done. It'll go by just like that. All right. All right. So Egan's book are these chapters, the CARC book. I don't have one of them with me, but it's a clinical, what is it called? Clinical Assessment for Respiratory Care book. That's another book that you're going to have. Several books. I'm sure you see that when you got your books, there's several books that you're going to have. And so for this one, they want you to read chapter 1 and 2 in that book. All right. Now, the workbook, don't worry about. I'm not going to make that due. Only thing to be due in this section will be the homeworks 1, 2, 3, 4, and 5. And I might not give them all to you. You might just end up doing 1 and 2. I might have something else to do for homework, or I may have you do some vocabulary from the chapters. Okay. So that's how that's going to work. Tuesday, we'll continue to lecture tomorrow. And then Wednesday, we're going to review. And at the end of the day, we're going to take the exam. So you won't start right at 1. We'll review from like 1 to 4 or 5 or something. In that last hour, I'll let you take your exam. Okay. Then on Thursday, the 7th, we go into the next section, which is RT210b, Cardiac A&P. These are the chapters they want you to look at for cardiovascular A&P in the Egan's. There's 2 chapters in the SEALS book, which is a yellow and blue book. And the CARC book has 3, 4, 7, and 11. So you see, it's a lot of reading. You don't have time to, I'll get with it later, or I'm going to go do this and go do that. You have to stay on top of it, guys, especially having a large class like we do. Okay, you got to stay on top of it. Try your best to be live every day so you can ask questions if you're not here. Now, that brings us to the question about being on campus. as of right now, we can only have 9 people in the classroom with me. So that's 10 total, okay? So I'm gonna have to email you or talk about some type of structure where I can get everybody in and rotate it, because I want the same people to always be here, or they always get to be here. I don't never get to come, stuff like that. We don't want to run into that. All right. But you do have on exam and lab days, you have to come. On exam and lab days, you have to be at school. And that goes with your alpha and omega group. Okay. So look at this. On the 6th, which is Wednesday, we have our exam. Everybody needs to be here for the exam, and you just come at your regular time for your alpha or omega group, right? Remember, alpha, look right here, alpha is 1 to 3, omega is 4 to 6, okay? Alpha is 1 to 3, omega is 1 to 6. Copy and paste that right there. So just because it's not written over, it's the same thing. Right? Okay. All right. So the alpha group comes at 1. Anytime you have to come to the school for not review, but lab or exam, you come with your group 1 to 3, 4 to 6. Now, please keep in mind, that doesn't mean you can come between 1 and 3 or between 4 and 6. That means you need to be here at 1 or at 4. Because as I explain lab and go over examples in the lab, it's too much for me to have to do it again when you come at 1:30 or 2 o'clock trying to do your 1 to 3. You're going to come in, do your exam. Well, see, that day it'll just be simple exams, so it won't be much, okay? But when it's a lab day too, we're going to be doing lab and have to do the exam, okay? So you'll need to be read up on your information so you'll kind of understand what I want with lab. Now, I'm not going to throw you out there, here's the lab, check off. Of course, we'll be showing you. That's why being here on time is very important, so that we go into the lab next door and do the first 2 hours, the first about hour and a half, just knocking out the lab, or the first hour showing you the lab, letting you check off right quick, and then take the exam, okay? If we have to run over a little bit, that's fine. But as far as being on time, if you're like an hour late, I'm just going to send you the way you're going to have to make that one up, okay? You're going to have to make that up. Now, our makeup policy, we'll go over that when we get to that part of the syllabus, all right? So this Wednesday, everybody has to come to campus at your assigned time, okay? Now, we'll keep going. B will be lecturing on B on Thursday, Friday, and Monday. Then Tuesday is the RT210B's exam and lab, okay? The lab book. This is the lab book. Very important friend of yours. This lab book tells you of the chapter in which what we're going to be coming from, chapter 6 and 31 for part RT210B. So chapter 6 and chapter 31, you'll go into this book and be looking at that and studying out of this book. So you'll know what to expect in the lab, exactly how we expect to do it, what area, what artery are we talking about. And I asked you to do the critical thinking questions, page 83 through 87, okay? It's just it's not that many critical thinking questions. And that's going to just talk about this, what we're talking about, cardiac AMP. You'll have that ready for you when you come to lab, all right? Now, the lab, the way it does it is, it's just like a checkoff. I'll watch you do it. Looks like this. This will be at the end of that lab when you read whatever answers, questions you have. At the end, this is what you're going to put your name at the top, and then we're going to do the lab, and I'm going to check you all, put my name at the bottom, and you keep it in your lab book. This lab book will follow you for the whole 50 weeks of respiratory. So you go to 210, 220 with the same book, 230 with the same book, 240 with the same book, 250. At the end of 250, Mr. Kerbo is going to take this book and pull out everything that you've done. You have to have all of that in order to graduate. If all your labs are not complete, you cannot graduate, okay? If you don't do all of your labs for RT210, you can't go to 220. It's a pass or fail. Okay. So if you have to make up a lab, you need to make sure you say, okay, and it's not my responsibility. I cannot remember who did what lab, who was absent for what lab, stuff like that. I won't be able to remember that. So you'll have to say, okay, I didn't do pulse ox and blood pressure lab. I need to make that up. Okay, so all the pages that need to be checked off are in here. So look right here. The EKG, pulse, blood pressure, and pulse ox lab is page 89, 91, 93, and 549. Those are all checkoff pages. So when you go through and start looking, say, oh, before we get to the end, you can say, okay, hey, I got this one I need to make up. This one didn't get checked off. I need to schedule a time to make it up. Because I can't be at the end of the class and you got 5 or 6 labs that need to be made up. I won't be able to do that because I'll be trying to make your lab up, somebody else's lab up. We just cannot do that, especially with almost 20 people. Okay, so please be here on time and on the days for the lab at least. If you don't never come to class, at least make sure you're on time and do these labs. Okay, that's going to save you a lot of time in the end. Now, as far as those alpha omega groups, I'm going to show you those again here. All right. This is the alpha omega groups. Alpha group from 1 to 3, we have Cassidy, Kenya, Kelsey, Courtney, Maria, Michaelin, Heather, Shatara, and Brittany. Omega group, Christian, Charisma, Zenitra, Stephanie, Kiara, Sydney, Diamond, Tori, Lori, and Talicia. Those are the groups. Now, if you want to switch groups with somebody, you need to get with them and ask them, do they mind? And both of you need to email me saying it's cool. Okay, you can't just say, Kiara said I could switch to 4 to 6, and then that's it. If Kiara doesn't email me and let me know the same thing you just said, I'm not going to make the switch. Okay. All right, so that'd be told. It's not for me to ask another student. You guys need to get with each other and ask if you want to swap. Okay. Other than that, these are the groups the times you come for tests and lab. Right. So you'll notice the way we're doing this 3-day lecture, test, 3-day lecture, test, 3-day lecture, test. That's how it's going to go. Okay. Every unit does not have a lab. Okay. Every unit does not have a lab. We don't have that many labs. So you go back to the syllabus. Okay, so this first one we're doing now, it doesn't even really have a lab. It's supposed to do hand washing, but I pushed it somewhere else, so we already were short on time. All right, so cardiac A&P has this lab here, the EKG, pulse ox, blood pressure lab. Okay, then let's see, RT210C is pulmonary A&P, about the lungs. 2 chapters to read in Egan's, 1, 2, 3 homework. All right, you're going to lecture that day. You're going to lecture Thursday. You're going to be off of MLK. Come back on the 19th Tuesday, lecture. And then Wednesday the 20th is the exam. Alpha come at 1, Omega come at 4. Lab book page 37 is the one I'm going to check off, which is simply hand washing. Simple. Okay. Then we're going to go into the next one, the next day, which is RT210b Pulmonary Mechanics. That's what I'm going to start talking about. How air goes in and out of the lungs and what volumes, how do we find those volumes and the minute ventilations and all of the normal values for air going in and out of the lungs. Pulmonary mechanics is a more, it's a little more tough than the rest of them, okay? You got 4 volumes and 4 capacities. You're going to mute your mic. Shatara, you need to mute your mic. Thank you. All right, so it's got a lot of in and out of minute ventilations, things like that you're going to have to know, memorize the volume, memorize how to explain it. Those things are kind of tough. Okay? All right. Let's see. Pulmonary mechanics, chapter 6, 11, and 12 of the Egan's book. You notice it has homework 1, 2, 3, 4, and 5 of that one. You lecture that day, lecture Friday, come back on Monday, lecture, Tuesday, exam. See, no lab for that. Do the exam, you go home. All right. The tests are 20 questions, maybe 25. At the most, you'll have 35 minutes to do a test. Okay. Once you start it, you have about 35 minutes to complete. Now, I will open it up for your whole 1 to 3. If you're alpha, it'll be open from 1 to 3. Okay.
So we come here right for that field.
Yeah, you come. Yeah, come on in. But like I said, on exam, if you only have exam, then I'm not really worried about what time you come, as long as you know that when you start the exam, you got 35 minutes to take it. And once you run out of time, you out. So if the exam is open from 1 to 3 and you don't get here at 2:45, then you got 15 minutes to take it. That's on you. Okay. Unless something prior arranged, like, I got something going on, I got to be a little late that day or whatever, we can talk about making it up. Now, the highest grade you can get on a makeup test is an 89. Can't get 100 on a makeup test, okay? But you see that there's no lab for D, all right? Wednesday is acid-base chemistry, which is ABGs, RT210E. So go to chapters, so go to homework, lecture on Wednesday, Thursday, Friday, Monday, the test. No lab, okay? And so that's how that goes, guys. It's going to go just like that all the way down to J. We're going to go down all the way to RT210. J is the last one, okay? Hyperinflation, restrictive versus obstructive diseases. That's the last unit, okay? You're going to take that. It has a lab on Monday, March the 1st. You'll take that lab and that exam. Then we start reviewing for the oral and the final. Now, the oral exam is a final exam by mouth, okay? The oral exam is 20 questions that you would choose, and they're not color-coded. They're different colors, but they're not in any kind of arrangement. This is how they look. Laminated cards. Each one has a question on it. So, for instance, when I pick this one, the teacher will let you pick out 20 that you can't see. You're just going to pick 20, put them down, face down. And then he or she will read the question face to face with you. It won't be me, because they don't want me to be biased. So I can't do any of the oral. It'll be the other RT instructors who don't know you, okay? So you'll pick a question, they'll pick it up. This is one of the questions. And these are actual questions. I go over these as we go. They're A, B, C, the same way we're doing it. So as we get into A and B, I may do a review day and say, okay, we're going to do a practice oral, and I'm going to practice over just A and B, right? To see if you can remember. You've got to go back and study. When you get to B, you need to go back to A and study that one hard. When you get to C, go back to B and A. Okay, you have to remember the old stuff. It works together. All of this stuff now works together in respiratory. You can't just, okay, I got A, I'm done with A. I got B, I'm done with B. You can't do that. They all work together. You also may have 1 or 2 questions on RT210F exam that comes from A. Okay, so you have to keep your stuff in order. So for instance, this question here is a category pharmacology, right? Pharmacology says hypertonic saline is indicated for what treatment? You would have learned that is for sputum induction. We want them to cough up something. We give them hypertonic saline, okay? Breathing treatment. And that will help them cough up some junk for us to go test. That's that one. If you get it right, they'll put us, okay, you got that. All right? 20 questions, 5 points apiece. You have to get at least 5 of them right. I mean, you can miss 5 to pass. 75, right? 75 is passing. So that's the oral. The very next day is the final, which is a written exam. The written final, which is 100 questions. The written final is 100 questions, okay? Of course, we have a little bit more time to do those. I think you get like 2.5 hours for that one. It's 1.5 minutes per question, okay? So that's how we do it. Now, let me go back to the syllabus so we can go over grading, dress code, that kind of stuff like that. And all this is being recorded, guys. So if you missed any of it, when we get done with class today, you can go back and watch it. Okay, it'll be at the bottom of the module. I always go back to my module and insert it. Okay. Let's see here. Let's look at the Canvas, because I'm hearing a lot of questions about the Canvas. Now, when you log into your Canvas, you get this little page here with all of this stuff on the side. You guys, I don't want you going to quizzes, assignments, all that kind of stuff over here. You don't have to worry about that. Everything needs to be accessed through the module. Okay. So when you log in, you come down here to module, click module. Okay. Whatever module we're in, that's what we're doing. Okay. This first module is a failed exam practice review work. So for instance, say you failed RT210b. Okay. There is a Rt210b test you have to take here. It's not a test. It's kind of like a practice and review. It's called practice and review. Now, it may be about 35, 40 questions, and they are really difficult. You definitely got to go in the book to find these, okay? But what that does is it's not graded. It's not going to be for a grade. But what it is just simply lets the student have a deeper review and practice back into that section so they can see what they missed, what they don't understand, stuff like that, okay? And then you have to complete that before you take the next exam. All right. So if you fail RT210A, or I don't even do one for A, I don't think. Yeah. So if you fail 210B, which is cardiac A&P, then before you can take RT210C's exam, you have to have done this practice and review right here, which is cardiac A&P. Okay. You'll just click it and complete it. Take a picture of it, send it to me, email it, whatever. And all I need to know is that you did it. Okay.
So that's what we do.
If you fail a test. Yeah, well, the other assignments is going to have an upload link. This one doesn't have an upload link. It's just simply take a picture of it, email it to me. This one right here is if you fail an exam. Okay. So that's why this one's closed for right now. It's nothing for you to do. Now, we're in this module right here, RT210A, Measurements and Technology. You want to find my Zoom link right here every day. Just come click it and log into the lecture for the day, okay? That greeting students video that I put up on, I think, the 21st of December, that was just kind of explaining what I was expecting, the days we get started and all of that. This is the syllabus right here, 2012 syllabus. This is the CLN 2012, right? This is the syllabus that we're talking about. This is what you're going by right now. There's a respiratory vocabulary document here that there's some very important vocabulary words that you'll need to know as you go on, because as we go on, the instructors will speak to you in respiratory terminology. All right. And a lot of students are getting on to 230, 240 and having no idea what some of these words are. So you're going to be, sometimes I throw 3 or 4 of these words on a test. Like at the end of the test, I might throw 3 vocabulary words, okay? And so you need to be studying them so that you can do that. The PowerPoint for A is right here. The lesson plan, which I'm gonna be showing you, is not available for you to see, but it will be as I'm going over it. Okay, it's property of Concord. The study guide. The study guide for A is right here. So at the end, you want to know what's all going to be on the test, what I need to study for, just go over the study guide. RT210A note-taking guide. This is the note-taking guide that you guys are going to be writing as I'm lecturing today. When I start lecturing, you need to have that one out, print it out or whatever, so you can start writing it, okay? It's going to look just like the lesson plan, except it has some blanks. So I just kind of fill in the blank and write in. If I have 4 or 5 electrolytes or something, it might say electrolytes and you have to fill them in, stuff like that, okay? It's just kind of, it makes it really simple for you to take notes. This was the Welcome to 210 watch. You don't have to watch that anymore. Then there's some HIPAA stuff we have to go over a little bit later, okay? Then finally, RT210A unit exam. When it's available, you want to take it, all right? Now, the homeworks. You don't see them in here right now because I haven't assigned any, okay? When I assign one, I'm going to add RT210 homework for tonight. Do number 1 and 2, or do number 2, whatever I decide. and it will pop up on here, okay? And you'll see it. It'll be a little bit indented, so it always looks the same. It's going to also have a date right up under it. So today's date is the 4th. It'll say due January 4th by 11:59, okay? So all you got to do is click it, do it, upload it by midnight, okay? That'll be your attendance for today and your homework grade, okay? All right, Diamond entering. All right. So if you're just now entering class today, guys, this is what I'm talking about. You would have missed a whole lot because at 1 o'clock I get started. Now, granted, you do have this recorded, but there might have been something that you wanted to go back and forth with me about, ask questions about that you're not able to do when you're watching it at home. Okay. So like, especially when we're on cardiac A&P, by the time 140 gets here, we have passed a whole lot of information. You'll be trying to get the notes or get some explanation from somebody. It makes it hard, guys. Make sure you're in here at 1 o'clock. All right. So after that, when we get done, take the test for A. We're going to start. I'm going to close that one, and we're going to B. Now, I'm going to close it on here, but it's still accessible to you. All of the previous modules will be open to you until we're done. Okay? You can always go back, look at the video, go back, look at the PowerPoint to study. Okay? But when we get to the next module, that's RT210b, cardiac A&P. Now, you notice there's a live lecture still already in here. I got to delete. I haven't deleted it yet from last class. Okay? But that's just how it would look to you. Okay? It would say live lecture for whatever date we are when we get to that. This is an example of the homework. Like I did last time, I told them to do homework 3 and 4 by 11:59 on October 15th. Okay? And they had to complete it. They'll open it up. And it's going to say, not all homework are done in order. That being said, complete RT210B homework 3 and 4 by 11:59 tonight. Use the book, lecture, and internet to aid you on completion. Now, that's going to be in this packet, okay? RT210, I'm going to go down to B. All right, so I just go, and they're in order. RT210A number 4. All right, let's look. RT210B skips back to B, and this is number 1. Okay, RT210B number 1. Then, of course, common sense, RT210 number 2. See that? You notice right here is where it says RT or whatever the letter is. RT210A, B, or C, or whatever is right here in the corner. And then right here is the number, which one it is. Homework number 1, number 2, number 3, whatever it is. So you would take that number 2, answer those questions, take a picture of it, and upload it to your Canvas. Okay? Simple. Try to make the homework as simple as possible to turn it in. Okay? Once you do that, you are complete for that homework assignment. You have attendance for that day, and I can turn in attendance the next morning. All right? Now, breaks. I lecture from 1 to 6, but I give a break every hour. So every hour, I will do a 10-minute break. Okay, so from like 1 to 1:50, we will lecture. I will stop at 1:50, pause the recording, and you can take a 10-minute break, come back at 2 o'clock. We pick up where we left off at 2 o'clock, right? 2 to 2:50, another break. Sometimes I may give a 20 in there, just depending on what's going on. But like I said, it's recorded, and so you're able to go back. Now, the recording is not something that's guaranteed, all right? Recording is not guaranteed. This is something, the luxury that I'm doing, all right? Just like if you were in class and we weren't on virtual. If you were absent one day, you just absent, right? You got to get those notes from somebody who had them, right? I wouldn't go over all of that again, right? So it's your responsibility to get this information. And because sometimes things happen and I'm not able to record, or it didn't load or something like that, there's no guarantee. Haven't had that problem yet, but maybe once. All right, so that being said, we got about 5 more minutes. We're going to take our first break. So that's RT210B. See how that goes along? Got this little stuff, right? It's got the exam at the end. Once that's done, I'll go into RT210C. Cardiac A&P. Here goes the Zoom link. You're going to have lectures, homework, PowerPoints and stuff, and then at the bottom, exam. Okay, question.
With the note-taking guide in the module,
Mhm.
you print out that one for that whole module for
Yeah,
that
you-
day for that letter. Is that for all 3 of the days in the lecture?
That's the whole module.
Okay.
So for instance, let's look at this one, RT210A, which we're on now. The note-taking guide right here, RT210A note-taking guide. That's the whole note-taking guide for A. Not a daily thing. That's it for A. Now, you'll need to print it out at home or whatever. I emailed it to everybody, all of them. I did A all the way through K, I think, to everybody. So all you gotta do is go to your email, pick it, and print them off. It's best to go ahead and print them off, put holes in them, and get them in your notes behind each other so you don't have to run into the organization issue. But this is how it looks. We're going to talk about this today, the history of respiratory, what these organizations are, AARC, which is the Association for Respiratory Care, American Association for Respiratory Care, Aarc, NBRC, you'll have to write that out. See, it'll be something you just write out. Then we talk about hospital organization, right? We're going to talk about tasks and priorities, what you should be doing first and last as a respiratory therapist, get into measurements. There's a lot of things about measurements. We're going to do a lot of converting from centimeters to inches, kilograms to pounds, cc's, milliliters, all that kind of stuff. Very important in respiratory, okay? Celsius, Fahrenheit, all those things. You got to know those formulas, how to convert this to Celsius to Fahrenheit, how to go back the other way, things like that. Very important. But this is how the note-taking guide looks. You just print it out and do that, okay? All right, let me go to the syllabus and then I'll open up for some questions. Let me go back to the syllabus. All right. Let's look at the other stuff. Yeah, now, at the end of the exam, after the final exam, we got to do CPR, right? There's going to be some CPR lessons that will be in your modules for you to complete at home. It's the whole BLS CPR video that you watch a little bit at a time, broken down into 3 parts. And then there's a BLS exam A and a BLS exam B. If you don't pass A, they let you retake on CPR, but you have to take version B, okay? And that should be an easy 100 because that one's open book, okay? Even if you already have your CPR and all that, you still have to do this because it's a grade, okay? So you take your CPR stuff, you'll come in on that last day, like March the 10th, everybody's going to come in to do their CPR checkover. That's with the mannequin doing the chest compressions and bagging and all that. Of course, alpha and omega groups will be separate. And then that's the last day. On the 11th, my son did that. On the 11th, clinical orientation, there'll be the 220 teacher will come talk to y'all, and they haven't been really doing it because of COVID, but they'll usually come talk to you, let you know something about what to expect going into your clinicals, right? When you go to clinicals, guys, there's going to be in clinicals 4 days a week, Tuesday through Friday. You can't be late, be missing. They will kick you out of that clinical site, okay? You have to be in full dress code, all of that. They have 2 sections as far as times. You're going to go either at 6:45 in the morning to 3:15 or 2:45 to 11:15, okay? That's going to be the shifts for clinicals. Now, I don't know what hospital we're going to have available at that time. COVID could get better or worse, all right? There are a lot of students who are behind in clinicals who they're going to do first because when COVID hit, they kicked the students out. So we have some students who graduated but still need more hours of clinicals. So as they open back up, we've been sending them first, okay? So, but other than that, we usually have St. Francis, Park and Bartlett, all of the Methodist hospitals, South Germantown, stuff like that, University. The Med, we've been having for a long time, but the Med now wants a full-time instructor to come with them all the time, so I don't think that's going to happen, but it may. So if you want to see trauma, that's where you want to go, to the Med. But that might not be open. I know they have one in Baptist Restorative, Baptist Tipton, Covington, stuff like that. Corinth, Mississippi has a hospital down there. So there's a lot of opportunity. Oh, I don't know. Baptist DeSoto? I don't know. They might. I'm not sure. But like I said, that clinical orientation is when they'll come tell you about the shots you got to take, what to expect. You know, there's the VA also there, but there's like a whole lot of stuff you got to do to be accepted into the VA. And drug tests. Guys, a lot of students are being kicked out of respiratory from smoking weed. I'm telling you now, you're going to have a surprise drug screen. It may be sooner, it may be later. All right. But what it is after a test day, they're going to say, okay, you took your test. Okay, sit right there. You can't go to the bathroom. And they're going to come get you from the classroom and take you to your drug screen. If you fail the drug screen from marijuana or some type of pain pill or whatever, and you don't have a prescription for it, you're out of respiratory, period. Okay, all that money down the drain. Okay, so I'm telling you now, if you're around somebody that smokes weed or you smoking weed, you need to stop now because it takes a long time to get out of your system. Okay, at least 2 months, especially depending on how long you smoke. It can take about 2 months to get out of your system. So you mess around and stop smoking, a month ago and it's still there. Guess what? You're out of respiratory, period. All right. Now I'm going to ask some questions. I'll let you ask me some questions, and then I'll go over some of these grading policies and stuff like that. Does anybody have a question about what we talked about so far? All right, you can put it, let me see, I'm going to check my chat. One question says, can we wear scrub hats with our uniform? Yeah, you can wear a scrub hat, yeah. You can't wear those bands, though. I don't think you can wear those headbands and stuff like that. And as far as the scrub hats, I haven't heard anything being a problem with it. So as of right now, yes. So if you have a question, you can put it in the chat, and I'll read your question unless you want to say it. Mm-hmm. That's not nothing y'all have to worry about. Y'all not gonna be external. Yeah, don't worry about the external. What kind of shoes do we need? The shoes are supposed to be closed-toed shoes. You not supposed to wear the mesh shoes or anything with open toes. Crocs are not acceptable. They have to be closed-toed shoes. Now, if you go to Concord Central, the Concord Internet thing, that should tell you all of the dress code. You guys were told, the dress code at some point since you've been here. But that's, I don't know it all to the T like that. Okay, but I do know it's in Concord Central. You go down to where find out about the dress code. It'll tell you all about that. But a few things that I know is hair is supposed to be natural hue. All right, it needs to be out of your face. Fingernails, fake fingernails, overlays and acrylics and all that, can't have it. Your fingernail needs to be almost the same level as your skin. All right, those are all for hygiene issues. But other than that, wear your scrubs every day. Make sure they're clean, iron, your lab coat. You don't have to wear the lab coat 24/7. You can take it off. Also, your stethoscope. When they give you your stethoscope with your books, you have to have as part of your dress code. Your name tag, a watch, all that's part of the dress code. Okay, every good respiratory therapist is prepared with a watch, stethoscope, stuff like that at all times. Okay, we count a lot of respiratory rate. We count a lot of different issues, blood pressures, manual, all kind of stuff. You got to have your watch. Another question. Yeah, Apple Watches are okay, but not during tests.
Yeah, so you just put them in our backpack.
Yeah, that's fine, just like your phone. Mm-hmm. If you haven't gotten a name tag and stuff, y'all got to, I can do for your name tag or your uniform. All that stuff is stuff you call up here to get. There should be, they do name tags, at any time, and they ain't gonna mail it to you or nothing. So you just have to come up here and say, I need to get another name tag made, and somebody will be here to make it for you. Chris is the guy that does it, but he'll get that done. Okay. What if we don't have received? Oh yeah. So if you haven't gotten your uniforms yet, that's okay. We understand. Whenever they get them, you put them on. Okay. Okay. And says, what do we have due tonight? What's due tonight will be at the end of the lecture. I'll let you know. All right. As far as the class, though, is any other questions on what to expect about what days to be here, anything like that before we get started? What's that? Okay. Yeah. Mm-hmm. All right. So yeah, for homework tonight will be I'll give you an example. I'll give you a homework assignment at the end of the lecture. When I say, okay, the lecture is complete, I will say goodbye and I will start working on putting the homework assignment in. So the next 5 or 10 minutes after the lecture is done, your homework assignment will pop up in the module, okay? Remember, go to the module and work through the module every day. Don't go to the side looking for assignments, quizzes and all grades, all that kind of stuff. Your grade that's in Canvas is not necessarily your grade. That's a very important one there. Your grade in Canvas won't be because a lot of these completion and participation stuff is being added for attendance. So it's like, well, so I got this in Canvas. Canvas is not your grade. Your grade consists of your exams, okay? Your exams and your homework at the end, right? So if you say we've done 5 exams and you want to know what your grade is, average those 5 exams. That's your grade, okay? Especially if you've done all your homeworks, okay? If you've done all your homeworks, average those exams, and that's your grade. So if you got 500s, then your grade is 100, okay? So that's how you do that. Periodically, I'll let you know where you are because we use a different spreadsheet for the grades. I have your homework is already anticipating 100, so that's factored into the spreadsheet, okay? And so, matter of fact, my spreadsheet will probably be a little higher than what you see on Canvas anyway, okay? But if you periodically, I'll say, okay, this is where you are right now. Especially when we get close to the end, guys, I'll show you, okay, this is what you need to make on the next 2 tests to pass, okay? The final is, okay, let me show you that, then we're going to take a break. Show you this, I'm going to take a break. Syllabus, okay? All right, let me show you the percentages. The grades are about 5% of your grade. The unit exams, A, B, C, D, E, F, G, H, I, and J are 5%. That's how much they weigh, okay? Then your K, which is CPR, which is open book. So that should be an easy 100. But that's about 6% of your grade. You don't have a project. I don't assign Q&A cards. LRC, don't worry about that. Lab is pass or fail. If you don't have all your labs, even if you got 100 average and you got 2 or 3 labs you just didn't do because you didn't feel like coming and you never made it up, you fail. You got to do it again. All right. And it's on you to get those done. It's not on me to remind you, hey, you got this lab and that lab. It's totally on you. All right. Classwork and homework. That's kind of like what I'm talking about, those homeworks that I do. I just grade them to see if you've done them, right? But if you start taking and not doing them, then I start taking away from that 100. Okay. And then your oral exam, 16%. The oral is 16%, and then the final is 26%. So the final is very, very heavy. You can, if you get 75, see, 75 is what you need to pass exam. 75 is passing, okay? If you get a 75 all the way through, but then bomb the final, you're going to fail, okay? But if you have A's and B's all the way through and you have a bad day and you bomb the final, you still can pass, okay? It just depends on how much work you put in on the front end, all right? So this is the weight of the grades here, okay? 75%, less than 75 is failing, okay? 75 to 79 is a C, 80 to 89 is a B, 90 to 100 is an A. All right? Makeup work, this is simple. Oh, yeah. We do not round. So a 74.9 is a 74, which means you failed that test. Okay, they don't round. Calculators. You can use calculators, regular calculators that we have, or if you have a calculator. You cannot use your phone as a calculator. Okay, during exam. Now, we just out here doing practice stuff. I put some stuff on the board. You can use your phone for a calculation then. But as far as the test is concerned, you cannot use it on a test. All right. Now, the makeup work is for people who are few and far in between. You know, you got a tire blew out on the highway and you missed that time, whatever. We can understand that. Now, if your tire blow out 3 times a week, then you're not going to be able to do it. So it doesn't mean just because you miss, you guaranteed to make it up. It's only really at my discretion. Okay. But I like to let everybody get that chance. I don't want you to fail. I want everybody to pass. Okay. And I promise you, I'm going to give you what you need to pass. Okay. This is what I do. All right. I am still active in the hospital. Okay. So I understand how things happen. All right. But if it's something every time test comes, something happens, they're going to say, no, she can't, or he can't take that. You're just going to fail that one. Okay. If you fail a test, you cannot make it up. You can't retake. I'm sorry. You cannot retake it just because you failed it. Okay. If you failed it, it's gone. That's what you got. Okay. All right. Tutoring will be available. I will email you on my times, and I see what's good for my times as far as tutoring is concerned. Tutoring will be on Zoom. Okay, so I'll give some times I'm available from this time to this time on these certain days, and all you gotta do is just log into Zoom and I'll be on. Okay, and we can go over some things like that. Exams, yeah, virtual testing. Now, testing used to be, when we first started with the COVID, was kind of bad. We had to have a camera set up at home watching you take the test. Okay, you needed your computer and a phone so that I could see, because a lot of students were cheating. Right? I mean, you at home, it's easy to cheat. Okay, but it shows up when you come take that final on campus and don't know anything. Okay, so it's just gonna hurt you in the end. All right. But as far as that, we're taking tests on campus now, so don't worry about the virtual testing proctor. I'll be in the room, we'll be watching. Okay. All right. Attendance warning and absences and stuff like that. Just, I'm sure they went over you about the attendance. There's just, just be on time and come. All right. You can't be put on warning if you get to a certain amount. You missed more than 10% of RT210. Then when you get to RT220, you'll be on attendance warning. Okay. If you violate 10% in 220, then you're going to 230 on probation. If you violate probation, you're out. Okay. But once you say you want on warning for 220, but you go through 220 with no problems, then you're out for warning, you're back fresh. Okay. That's pretty much the attendance issues there. Cell phones, no cell phones in the classroom when we're taking the test. And preferably when I'm lecturing, if you got some stuff going on, you need to step out and handle your business, okay? But frequent in and out is a distraction, all right? So just try your best to deal with whatever issues you got after class or before class. But if you got something going on, that's fine. Say, hey, I got a child is sick or my mom's sick, whatever, I may have to step out. That's fine, all right? If you are online and you have to step out and I'm doing a lecture, it's better if you have your camera on, okay? That way, if I'm asking something, I'm reading something, I say, okay, Maria, what do you think about this one right here? And then it's crickets, because Maria went to the store. She's still logged in, but she's gone, right? I have no way of knowing that. But that kills my time if I'm waiting on her to say something and she's not there, all right? So if your camera is preferably that your camera is on during lecture. Now, if you're not going to be there, you can hit me in the chat and say, Mr. McCarthy, I got to step away for a little while. That way I can say, oh, okay, cool, and I won't ask you, right? I won't call on you and then kill my time, all right? Because sometimes it takes folks a little time to respond. But that, on top of you not even being there, kills my time, okay? So if you don't, now, last thing that I have, when you are on camera, I don't need to see you in your bed, okay? I don't need to see you with your hairnet on, in your gown, in your bed. During class time, you need to be up somewhere. Then you don't have to have on your uniform. They want you to have your uniform on, but you don't necessarily have to have it with me. I'm not really messed up with that, okay? But you do need to be out of the bed, and at least if you're in the bed, sitting up, dressed, okay? Don't need to see that because you are being recorded, all right? And other students are watching you, okay? Now, on exam days, we can come between those 2 hours. No, on exam days, you need to, yeah, I'm sorry. On exam days, you got those 2 hour window to get here. But once you start your test, Christian, you have 30 minutes to take, either 30 or 35 minutes to take the exam. Okay. So when you are, say you're supposed to be here from 1 to 3 and you get here at 2:30, well, as soon as you clock into that test, you only have that amount of time to finish it. But even if I give you 35 minutes, if the whole thing stops at 3, you're done at 3. So at 3 o'clock, your test is going to stop because the test is going to be available. So for instance, I would say RT210A test will be available to the alpha group from 1 p.m. to 3 p.m. Okay. At 3 p.m., it's going to stop, regardless if you just started or not. All right. You have to be here on time enough to take that exam. Now, granted, it's only 20 or 25 questions, so 30, 35 minutes should be enough time for you to get. Usually my students are done in 15 minutes or less, okay? And so it just is what it is. But yes, you can come in between those 2 hours as long as you understand that there's no extension for you to finish your test. Well, I came in at 2:45, but I thought I was going to get 30 minutes. Nope, at 3 o'clock, you're done. So whatever you got at that point, that's your grade. All right. All right, let's take a break. It's 2:06. Let's just say it's 2:05. Come back at 15 after. 2:15, we're going to start lecturing. 2:15. I'm going to pause the recording right here. So that's not eating up a lot of space. I'm going to pause the recording. I usually play a little bit of sounds in the background during my breaks, during study time to help relax you. Again, guys, this is for a wonderful profession that you're in. It's very rewarding, but this is going to be an arduous road ahead for 50 weeks. All right. If you don't pass 210, you will have to repeat 210. The next class for 210 will be 8 to 1. It's not 1 to 6 next time. I have to rotate every 10 weeks. 1 to 6 right now for these 10 weeks. The next class, I have to come from 8 to 1. And then 1 to 6, then 8 to 1. I've been doing that for 2 years now, okay? That's the way they flop. So a lot of students that fail think they come back the next time at the same time. It doesn't work like that. You're going to have to switch it up, okay? So please, whatever adjustments you need to make with your jobs about this 1 p.m. to 6 p.m. thing and those test exam days, you need to be off, because if you got to work every time we have an exam or test, you're not going to pass, okay? You got to do one or the other. All right, we're going to take a break. I'm pausing now. I'll be back at 2:15. Okay, guys, we're now back from break. Again, the RT210A note-taking guide is in the module. If you guys wanted to print it out, you need to have printed it out so you can take notes as I go along. RT210B, when we get to that, the module, the note-taking guide is in that module as well. Okay, they're in all of the modules, but like I said, when I get home, I will try to locate my other flash drive because I know it's on there, and I'll resend them out to everybody, all of the note-taking guides out to everybody. Okay. And we just do it like that. Yeah, that's it right here. Anyway, so I have them. I'll just send it out to you like that. All right, so let's go on. RT210A, measurements and terminology. All right, so I'm assuming that Kiara, Shatara, Talicia, none of you are available. Ms. Russell, Ms. Winston, cut your cameras on so I'll know who's here. And then I know who can call on and who not to call on. Okay? All right, here we go. I'm going to start with the lesson plan. Pull up the lesson plan.
Mr. McCarthy, do you want our cameras on now?
Yes, you can cut your camera on so I know who to call on if I ask any questions.
Okay.
If you guys need to step away or anything like that, then just put in the chat. I'm stepping away, or cut your camera off and I know you stepped away. Okay, if it's not on, then I'm not gonna call on you, because like I said, I don't know who's here. Then if I call and set up a whole nice 5-minute question and then somebody's not even there to answer. Okay, so let me get started. Lesson plan.
You said we don't need to turn our camera on.
Not if you're here. All right. Share my screen. All right, so you should be seeing the lesson plan. Go over some of the objectives. All right, so the objective for this module pretty much will be student will provide evidence of knowledge and understanding of school policies, define respiratory care practitioner's task, that's who you are, the respiratory care practitioner, describe the hospital organization, routes of communication within respiratory care, be able to convert metric to English measures and vice versa. Recall the abbreviations. There are a lot of abbreviations we're going to learn. Root words, prefixes, suffixes, and whole words, okay? Very important that you understand those. All right, Denitra, that's fine. All right, convert English to metric amounts and vice versa. Recall basic medical terminology, abbreviations used in respiratory care. We're going to talk about some ethical issues, ethical behaviors, how to handle treatment refusal. When somebody refuses a treatment, discuss relationships in the hospital, appropriate behavior for therapy and communication. Don't worry about the RT handbook, the tables and all that. We talked about that kind of stuff already, just the books that you already have. Now this says 70%, this is old, so it's really 75. Okay, 75% on all your stuff to pass. Okay. All right. Okay, let's get started with the first part. Introduction of staff and credentials. Talks about, this is talking about Concord here, just saying there's a medical director for the respiratory program. Mute your mic, whoever that is, mute your mics. The medical director of the respiratory program is Dr. Armando Fier. Dr. Armando Fier is the medical director. He works over at the VA and at Regional 1. Okay, he's the medical director of the respiratory program here at Concord. Program director is Mr. Kerbo. Director of clinical education is Ms. Faulkner. She's out on maternity leave. She should be back soon. Then, of course, you have instructors. Mr. McCarthy, that's me, RT210A instructor. This ain't stuff that you're going to be tested on this information. It's just, we're talking. 220 right now is Mr. Boyd. 230, Mr. Kerbo is taking that one. 240 is Mr. Moore. And then finally, 250 is Ms. Dean. Okay. Then financial aid and academic dean. Academic dean is Ms. Tonice Randolph. That's your academic dean. Then you have graduate services and all of that. And that's just the Concord stuff. Okay. We went over school policies, dress code, lab coat, name tag, appropriate shoes, which is no sandals. Be conservative, neat, right? Cleanliness. They say showered. I'm hoping everybody showered. Appropriate titles, rules of communication. Go to the if you have an issue, you bring it to me, okay? If that doesn't work, or your clinical coordinator, if it's a clinical issue, then go to the director, okay? Then go to administration after that. Don't go straight from he didn't give me the homework or let me do it straight to Tonice Randolph. She's not even gonna listen to you, okay? She's gonna ask you, did you go through the appropriate channels, okay? The attendance, this is kind of old as far as the for absence because we're not on campus. And then 75% is failing. So less than 75 is failing. All right, Respiratory Association. Now, this is where we get into the meat and potatoes. Association, the AARC, that will be an oral question all the way down the line. You got to remember who these people are. AARC is the American Association for Respiratory Care. What do? They promote the profession. AARC will promote the profession. Respiratory care, they give out respiratory care in AARC magazines. They give us clinical practice guidelines, right? They even go to Congress for you. If respiratory is not making the money that we should be making, or another discipline is infringing on the duties of a respiratory therapist, AARC is the one that goes to Congress and goes to the government to fix that. They also go to things that help us get paid, right? If you're doing some respiratory in the home, some private work, they're working on that where you'll be able to bill a patient's insurance. Once you become a registered respiratory therapist, you're considered respiratory excellence, okay? You can do anything respiratory to anybody as long as you are licensed in that state, okay? And so you want to be able to get billed. There's a lot of trach patients and vent patients that are at home, and that's good money working with those patients, all right? But the AARC, what you need to try to join, it's like $89 a year to be a part of that. Reason being is because you get those magazines, you get up-to-date clinical practice guidelines, you help them in getting us representation in Congress. And not only that, but you have to have continuing education courses every year. In the state of Tennessee, you got to get 12 a year to be licensed. If you don't get those 12 and they say, hey, where your 12? And you can't show them, they will suspend your license. Okay, your respiratory license, and you can't practice medicine until you get that fixed. All right, so they're called CEUs. You just got to, watching some seminar or whatever, you got to get 12, but you get half price when you're with the AARC. Then we have state societies, State Society for Respiratory Care. Like Tennessee has a state society, Tennessee State Society for Respiratory Care, okay? They give education and newsletters and stuff like that. That's a good little thing to be a part of. It's kind of like the AARC, but it's more specific to each state. Tennessee has one, Mississippi has one, Arkansas, all the states, okay? Another big one is the NBRC. The NBRC, that's the National Board for Respiratory Care. They are responsible for testing and certifying you either as a certified respiratory therapist or a registered respiratory therapist. So the AARC promotes the profession, and the NBRC is responsible for testing you to get those credentials, okay? They're responsible for credentialing you. So when you graduate, you have to take the TSAT, which is the board. You have to take a test here, okay? You'll have to take a test here first, okay? To graduate, it's gonna be your final test, and 250 will be like 150 questions, something like that, test on the computer, all right? Once you pass that and you graduate from Concord. After that, you have to sit for the board exam. And that's the NBRC. You will go to a remote location like H&R Block or somewhere in the back where they have these kiosks where you go sit down and take the test. This camera is watching you. If you drink a Coke or anything, they're going to cancel your test, okay? Because students cheat. They put answers in the bottom of the cup and everything. So if anybody talks to anything like that, you're done, okay? But that's the NBRC. You have to take that long board exam, which will either credential you as a CRT or a RRT. The difference is about $5 an hour more. So if you're a CRT and you get your RRT, then you start making $5 more an hour immediately, okay? They are phasing out the CRTs anyway. They're not even, A lot of them are not even accepting CRT no more. They want you to be RRT, okay? The difference is like a LPN or a RN, okay? That's the kind of way it's different, okay? A major difference. All right, so those are those. Then finally you have COARC. The COARC is the Committee on Accreditation for Respiratory Schools, okay? The Committee on Accreditation for Respiratory Schools is COARC, all right? They are the ones that go around to make sure that the respiratory schools are following the guidelines of the AARC, okay? If we're supposed to be teaching a certain curriculum and we're not, then COARC can suspend the program, all right? So they are responsible for accrediting respiratory schools. Concord is an accredited program by COARC, okay? We had something in the past not too long ago when we were put on probation because of the pass rate time frame. The day you started, your first day of gen eds to the day you're supposed to graduate is a date. And if you fail one of them and had to repeat, then that puts you in a category of not on time, okay? And so we got in trouble on some not on time students because students were not passing. You know, they'd start, but they wouldn't finish on time. They finished, but not on time. And so that was an issue. We did a lot of revisions and stuff. Then they just took that out because they just knew in today's society, it's not the same. You can't just expect them to go from the day one of gen eds to the graduation day, not missing not one of these courses. So they took that out. Now, respiratory, as far as respiratory is concerned, Concord has a 98th percentile of passing the board exam. Our students are in the 98th percentile for passing the board exam. So that's very, very high. One of the highest in the country is Concord, okay? You do the same amount of work that Baptist does, which is 4 years. They go to school and get a 4-year bachelor degree, but they still pass the same test that you take. You're getting associates because it's so fast, okay? But you graduating from associates and somebody who's graduating from the bachelor program go sit down beside each other and take the same board exam, become the same RRT and make the same money. Bachelor don't make any more money than associate, right? So if you got your associate RRT and you go back and get your bachelor's, your money does not move, not a penny, because you're bachelor's, okay? It only changed from CRT to RRT and time, of course, okay? All right, so COARC, responsible for accreditation of RT schools. All right, hospital administration or organization. Now, some of these might not be right in order with your note-taking guide. You just kind of have to look around. It's in there, though. Hospital organization. Of course, the hospital is organized into several different departments. You got admitting, billing and accounts, radiology, nursing, lab, education, engineering, housekeeping, nuclear med, dietary, pharmacy, and physical therapy. Also respiratory therapy. When this was made, we were under nursing, right? Nursing / respiratory. But we are no longer considered that. Like we used to be their stepchild type of thing, but respiratory is its own profession, okay? Nurses do not mess with respiratory modalities, and we don't do nursing, okay? Nursing can lose their license for messing with our respirators or our ventilators. They make changes on the ventilator, they can lose their license. All right, just like you lose yours if you push some morphine, okay? Not your role, okay? But that's how it's organized. All right. The TSRC is the state societies, Talisha. We just talked about the state societies. Right here, State Society for Respiratory. The TSEC is the Tennessee. All right. Now, respiratory therapy department itself, okay? As I just told you that the respiratory therapy at a hospital also has a medical director. It has to be a medical director. That's the person who oversees all of the clinical functions of the respiratory department. So we're out there practicing medicine, right? We're practicing medicine, we're sticking arteries, getting ABGs, we're giving meds, doing actual therapies, and they have to be governed by somebody, right? It's just not something, whoever that is, you need to mute your mic. Make sure your mic is muted. And so the medical director for respiratory in the hospital is usually a pulmonologist, okay? In this case, Dr. Fier is the medical director of respiratory at this school and at the med, right? And at the VA, okay? But you got a medical director. What are they responsible for? Look on your paper, look on the clinical functions of the department. That's what the medical director is responsible for, the clinical functions of the respiratory department, right? Then you have an administrative director, right? Then you have supervisors, secretaries, equipment personnel. That's the person who couldn't pass the board exam, working at the hospital, just working with equipment. They'll let you get a job as putting up equipment, okay? If you can't pass the test. Education coordinator. Then you have your therapist, either registered or certified therapist, okay? Now, these are the priorities of respiratory therapists. And this is the order, and you will have to memorize this order. So back in the day, we used to have what? Pagers, right? We used to have pagers in the hospital. When I was first starting in the hospital, and they still have pagers now. You might get a page to a certain area of the hospital, something going on. When I worked at the med, we might have trauma now. They may say trauma, ETA, 5 minutes, air. Then I might get a call, somebody needs some oxygen. I might get another call, somebody's complaining, Mr. Johnson complaining of chest pain, you know, those type of things. Well, this is the order in which you need to respond, okay? CPR. If there's a cold blue going on, that's the number one thing you go to. I don't care what other call you got. So say you got a page with all of these calls at the same time. This is the order in which you would respond to them. We're going to all of our cold blues first. CPR right here. CPR is cold blue, right? That's cold blue. Somebody's heart has stopped. Cardiopulmonary resuscitation. Cardiopulmonary resuscitation. Somebody's doing chest compressions, right? Somebody's dead. We're trying to bring them back. The next priority would be CMV, which is continuous mechanical ventilation. Continuous mechanical ventilation. Somebody who's on a ventilator, okay? So I'll put in parentheses, a ventilator. If the ventilator is acting up, that's be the second place you go. You want to make sure you go take care of that, okay? That's the life support, also known as a respirator, okay? All right, then ICU. Somebody call you about something in the ICU. That will be the next place you go then. Then the ER, which is the what? Emergency room. Emergency room. Somebody needed some a breathing treatment down in the emergency room or whatever. The emergency room call, that's where they fall in their order. Post-op care. Somebody who's coming out of surgery. You want to make sure you see about them. There's some things that you as a respiratory therapist are responsible for to make sure that they're breathing adequately after surgery. I had a monster drink. I don't know what I did with it. All right. O2 and aerosol therapy. O2 is oxygen, and aerosol therapy will be a breathing treatment. Okay. Somebody called for a routine breathing treatment. They'll fall in that order. All right. IPPB, which is also known, that is really hyperinflation. It's now hyperinflation therapy. Hyperinflation, that's when we hyperinflate somebody's lungs, and you'll learn later what we do it for. CPT, which is chest percussion therapy, when we beating on a patient's chest to help knock some of that secretions loose, right? That's CPT.
Hey, don't they call it the balloon?
Huh?
Do they call it the balloon?
The balloon.
The CPT? Uh-huh.
Mm-mm.
Where they inflate? Okay.
No. If they inflate a balloon inside of you, that's probably a stent, something in the artery for the heart.
Okay.
Yeah, we ain't doing all that. But IS is incentive spirometry. You're gonna learn what that is. That's when they take a deep breath. You ever seen this machine here in somebody's room or your room in the hospital? This right here.
I had to do that when I had my.
This right here, guys. This is an incentive spirometer. IS. Okay.
Yeah, I seen that with patients after they had heart surgery.
Okay. Well, they have either some type of surgery or any kind of post-op stuff. Okay. They're going to be sluggish, not breathing deep. And if persons don't breathe deep and normal, their lungs start to close up, which is called atelectasis. Okay. So we prevent that or treat that with incentive spirometry. And so this will be one of the modalities that they use. Okay. That's what IS is. We'll learn more about this in the last unit, which is hyperinflation, is J. Okay. And then diagnostic studies, like they wanted you to come get a spirometry on somebody or a ABG or something like that, where you have to test something, some diagnostic studies. That's how it would flow. Okay. Yes, hyperinflation. IPPB, which is intermittent positive breathing. IPPB was intermittent positive pressure breathing. That's the same thing as hyperinflation. That's what we call it now. Okay. So if I got mine, you have a test question that's going to say, put these in order. All right. It's going to have A, B, C, and D, and they're going to have all these in some type of order. You got to make sure you're able to put them in the right order. Okay. So CPR, CNV, which is the ventilator, ICU care, ER, post-op care, O2 and aerosol therapy, hyperinflation, CPT and IS, and diagnostic studies. They're from greatest to least. That's okay. And the test ain't gonna have each and every one. You just gotta pick the best choice on the test, okay? Now, hospital organization. Another question. Inflation and mobilization therapy, that's hyperinflation. When we hyperinflate the lungs, helps them cough up more secretions, right? Mobilization means to move secretions. When the lungs get pockets of secretions and they can't cough them up, we have ways that we can get them to mobilize them or move them, okay? Move them. All right, let's look at the hospital organization. Hospital organization. You got a board of directors. That's who put CEOs in the hospital. All right. You have a board of directors that will be the ones that hire and fire CEOs. All right. And if you don't have it, just write it down.
I think it's out of like.
You have to say it's probably switched around a little bit.
I'm just trying to put it like it is on here.
Administration. After that, you have administration. Then, of course, you have a medical director, department directors, and managers. Okay, and that's that. Now, let's do a quick review. Code Blue, medical director. AARC, MBRC, state organizations. How to chart as a student, don't worry about that part. And then triage. What is Code Blue? CPR. Somebody's heart has stopped, so we're doing cardiopulmonary resuscitation. All right? The medical director. What's the medical director's job? Responsible for the clinical functions of the RT department as a school or at the hospital. Okay? Somebody has to sign off on the stuff that you're doing. Okay? What does AARC stand for? Okay, American Association for Respiratory Care. What are they responsible for, Kiara? All right, so my recording got paused. I don't know when, but I'm just gonna make sure I understand that. The oxygenation and ventilation are two different things. Everybody understand that? Ventilation is an issue. Oxygenation can be an issue, okay? I can have an oxygenation problem, but not necessarily have a ventilation problem, okay? I'm breathing in fine, but my oxygen is just low for whatever disease reason, okay? So please keep that in mind. my alpha group will be my oxygenation group. And my omega group is my ventilation group. All right. And I'm not nothing special that you have to do. It's just that I want you to keep that in mind. All right. So you can understand that they're not the same. They're two separate entities or situations. All right. Now, we're going to get into those later as we get into ventilation and all that. But there is something I want you to write down. That's what I call Mr. McCarthy's AKAs. All right. My AKA this, AKA that. A lot of things you're going to learn as a respiratory have the same meaning. Okay. And they'll use them all the different ways. So I'm going to write them down on this board. All right. We're going to start with carbon dioxide. Try to get me a good pen that you can see good. Carbon dioxide. Which is CO2. Carbon dioxide. AKA acid. AKA ventilation. Acid, ventilation, AKA respiratory. AKA carbia. AKA capnia. Capnia. This is carbon dioxide. These are Mr. McCarthy's AKAs. You're going to hear this all kind of ways, okay? It's going to be very important that you learn this because when I'm talking about CO2, I'm talking about the acidity of the blood, right? I'm also talking about respiratory issue. I'm also talking about carbia, capnia. They both mean CO2, right? Ventilation. Remember I said ventilation is the control of the CO2 by ventilation, right? These are the AKAs of carbon dioxide. You got to know that. So I hope everybody has written this down. Write that down. Like I said, it's recording, so you'll be able to go back and pause it and write it down. But that's carbon dioxide, CO2. All right, now there's another aspect that we have to deal with, which is called bicarb. Bicarb, or bicarbonate, is our other side of the scale when we talk about acid and base, okay? Bicarb bicarbonate is known as HCO3. Bicarb, aka base, aka metabolic. I'm not the best speller. If I see something, let me know, okay? Never was. Bicarb, aka base, aka metabolic. All right. That's pretty much it on the bicarb.
Yeah. I don't know what's up with mine. Mine connected look too right here. Thank you, Jesus.
All right, bicarb, which is HCO3, aka base, aka metabolic. All right. Now, reason why I say this, guys, a little later you're going to learn acid-base chemistry. All right. You got CO2 on one side, you have base on the other side, which is bicarb, and they are trying to keep the pH in the middle. So if you think of CO2 being an acid, then you think of bicarb being a base, like Rolaids, right? Rolaids, milk of magnesia, right? Very alkaline, okay? So you can also put this, alkalosis. Bicarb, aka base, aka metabolic, aka alkalosis, alkaline, right? CO2 is acid, bicarb is alkaline, right? Now, this is what you're going to learn a little later. This is not on this coming test, but I need to put that in your head first, because this, what we're learning, is going to be with you for the rest of your respiratory career. So the earlier you get that locked into your head, the better, okay? So I'll scoot it up one more time to add that alkalosis to it. All right. Somebody waiting. All right. Just want you to have that in your mind. So two things, two issues. Ventilation and oxygenation are two different animals, okay? And when it comes to acid-base status, you have your AKAs, your ventilation, which is your CO2, and your base or your alkalosis is my bicarb, okay? So make sure you got those AKAs wrote down somewhere, highlighted and nice and pretty, so that you can refer back to them as we go on in the further lessons, okay? All right, it's 3:02. Let's take another 10-minute break. At the end of the hall now. I'm going to pause the recording, guys, for a 10-minute break. Come back about 3:12, 3:13, something like that, and we're going to continue on. 500 milliliters, what I'm asking. 500 milliliters will be how many liters? Write it in the chat for me. Because you want to see these gases, these volumes in both ways. You want to see them written as milliliters. You may see it as liters. Now, when you put it in the chat, put it in there privately to me. Don't just put it out there, because other people might not know and just copy your answer. Okay? But we're talking about liters and milliliters. Put it in the chat personally to me. How many liters is 500 milliliters? All right, let's see what some of my answers are. Talicia, good. Maria, good. Courtney, good. Talicia, good. Give me some more answers. Diamond, look at it again, Diamond. Stephanie, good. Look at it again, Christian. $500 milliliters is how many liters? 500 milliliters would be how many liters? A lot of your questions will be in either one, okay? You're going to have good Sydney, good Kelsey, Diamond, there you go, Diamond. You're going to have a lot of questions that it can go either way. Some of the questions might be in liters. They might ask you in milliliters. You got to be able to do this kind of stuff. Christian, you got to look at it one more time. Brittany, yours is off. Michaelin, that's good. Cassidy, that's good. All right, so it's 0.5, guys. 0.5. I asked, how many liters is 500 milliliters? and that's 0.5. So the normal tidal volume, or the normal gas that we breathe in and out of our lungs, which you'll learn a little bit later when we get to mechanics, is 500 milliliters. But your choices may have it in liters, and they don't have it in milliliters. They might say, what is the normal tidal volume? But it's written in liters, right? So you know, I know it's 500 milliliters. But if you don't know how to convert that, you're going to probably miss that question, because the answer choices may be in liters, okay? Also, temperature. Temperature, this is very important. You're going to have to know what centigrade is, the formula for centigrade or Celsius, and the formula for Fahrenheit, and the formula for Kelvin. The formula for centigrade, formula for Fahrenheit, and the formula for Kelvin. All right, now, because the normal body temperature is, what's the normal body temperature in Fahrenheit? Does anybody know when they scan you at the door every day you come in here? 98.6. 98.6 is the normal temperature of body temperature in Fahrenheit. Okay, normal body temperature in Fahrenheit is 98.6. Who can tell me in the chat what that is in Celsius? What is that in Celsius? And then we're going to do the formula. Write it in the chat if you can tell me what the normal body temperature is. You said it, you told me it was 98.6, right? In Fahrenheit, but what is that in Celsius? Let me look and see what we got. Good. Everybody looking good. Looking good. Brittany, you're off a little bit, but that's okay. All right, so the answer is 37, guys. 37 degrees. You might not have known that, but I'm going to show you how to figure that out. All right, 98.6 degrees Fahrenheit is 37 degrees Celsius. So if you get a question and say, what's the normal body temperature? You might know it as 98.6, but the answer choice might be 37 Celsius. Or they might say 37 Fahrenheit, right? You know that's wrong, right? You have to know these conversions, guys. And you're gonna have to study. I can go back, look at your YouTube or something, how to convert these decimals and stuff like that, because there's a lot of stuff you learned a long time ago that you haven't done in a long time. And you know, it's easy to forget. Let me see if it's on this other page here. So I can, here it is right here. I said, we're gonna go back to the others, but everybody look right here. Here goes your conversions right here. Look at the temperature. Let's scoot down the temperature, then we'll go back to the weight and linear. So Fahrenheit, the formula for Fahrenheit. What is the formula for Fahrenheit? All right. So Fahrenheit equals, don't forget, you always got to say that because this class is going to have a lot of formulas. A lot of formulas. So Fahrenheit equals, I'm going to take the share off so you can see. But Fahrenheit equals, so F equals, this is Fahrenheit, right? Equals 9/5, 9/5 times Celsius plus 32. That's how you find Fahrenheit. Now, you can also say this. What is 9 divided by 5? 9 divided by 5. Yes, it does. So let me stop share so you guys can see me better. So I can say 1.8. All right. Do this so you can see it better. All right. So Fahrenheit equals 9/5 times Celsius plus 32. If you don't like this, you can say 1.8 times Celsius plus 32. Right? That's an alternate way to do it. All right. And then the formula for Celsius equals 5/9. Right? 5 ninths times Fahrenheit minus 32. Now, what's important about this one is this is in parentheses. So what does that mean? No, what does it mean if part of the problem is in parentheses?
You do parentheses first.
Do parentheses first. Do parentheses first. Please excuse my dear Aunt Sally. Remember that? Parentheses, exponents, those order operations. You got to know your order of operations. So if you have parentheses, you got to do what's in parentheses first. All right. So whatever it is. So let's look at the first problem. Number 1, I want you guys to take 85 degrees Fahrenheit equals what Celsius? Now I have some calculators right here if you don't have a calculator. That's fine. Use the phone because I don't have my calculator. I want you to write that in the chat, guys. We'll do a couple, we're going to move on. All right, let me see what I got. I'm getting some of the same numbers. Let me figure it out. Okay. Now, you can also say this, guys. The Celsius can also be 0.55 times Fahrenheit minus 32. But either way, it's fine. I have to do what's in parentheses first, right? So I'm converting 85 degrees Fahrenheit to Celsius. So I got to do what's in parentheses first. So I have to work the problem out like this. 0.55 times 85 minus 32. Work that out first. What's 85 minus 32? All right. 85 minus 32. One at a time. 85 minus 32 is 53. This is 53. So 0.55 times 53. So 53 times 0.55 gives me 29.1 degrees Celsius. Yep. Right here.
So you just plug it in.
Yeah, I asked y'all, what is 85 degrees Fahrenheit in Celsius? So what is 85 degrees Fahrenheit in Celsius? So you have
Mr. McCarthy,
Yes.
Does it matter with the 0.1 or the 0.2? Like, can it just be 29? Or
Yeah,
do we
that's
have?
fine. Yeah, that would have
Okay.
been fine. Yeah. Yeah. So basically, all I want you to show me is that you know that you got to put this 85 in where the Fahrenheit is. Okay. We're trying to convert the Fahrenheit into Celsius. So the formula to find Celsius is right here. So all you do is plug in your number, right?
Celsius can be used, I mean, can be 0.55.
You can do 0.55 or 5/9. Just depends which one you want to do. It's fine. Okay. All right. Let's look at another one. All right. Let's do what is 101 degrees Celsius equals what Fahrenheit? 101 degrees Celsius equals what in Fahrenheit? All right. All right. See what I'm getting any
So we don't
answers.
have to put the point.
You know, I mean, depending on if it's really, it depends on what the point is. If the point is real high, then yeah, you want to round it up. But if it's like 0.1, then don't worry about it.
Okay, I got
All right.
that.
Okay. All right. So the answer is 213.8 or 214. 214 degrees. And all we did was simply use the Fahrenheit formula, which is, let's just say 1.8 times Celsius, which is 101. So we put 101 right here, plus 32. Now in this order operations, you got to do multiplication before you add, right? So 1.8 times 101 was 1.8 times 101 is 181. 181.8 plus 32. Give me 213.8 degrees Fahrenheit. Okay. So make sure you guys memorize those formulas because you're going to have to do that. You're going to have questions that say, they're going to give you a gamut of things. Mr. Johnson came in with a 39-degree fever. He was short of breath. His tidal volume was this or that. His ABG showed respiratory acidosis. All kind of things. It's one case study, right? And then it may have questions that's going to get you to pull stuff out of the questions, like what is his CO2 level? What is his temperature in Fahrenheit and stuff like that. You got to be able to do these swap out and convert. All right. Last one is Kelvin. Now, Kelvin is a really easy one, and we use Kelvin when we're measuring the temperature of gases. All gases are temperatures are read in Kelvin. Okay, Kelvin is simply Celsius plus 273. That's Kelvin. Okay, so when we're talking about gases like argon or nitric oxide or helium, and we're talking about temperatures of the gas, those temperatures are read in Kelvin. All right. Now, what will be hard is not hard, but difficult is if they give you this. They say, okay, what is 100 degrees Fahrenheit in Kelvin? And you're going to have a second step there. 100 degrees Fahrenheit is what in Kelvin? Y'all, I had to step for a second. Y'all worked out.
Basically, we don't have to go back and do it. Okay, well, like, I'm like, what, did I do this right? Because he said, I don't think so. Like, he skipped around kind of, and I'm like, oh shit. Because it's like, have you noticed that some of them are in the paper and like I'm kind of trying to jot them in and then we're going on somewhere. I'm like, oh Lord, be with me. Because like this one was even in the paperwork, I had to write it in deep. For some reason, it got cut out. And then this one, the conversion with metric to English, it went in there. It was all switched around, so I'm trying to like not miss something. He had him on the slide, like when he was doing it, and then he went back. Like I wrote my conversion from metric to English.
All right. All right, so let me see what my check says. I'm getting some 310, 311. Okay, let's look and see. So the first thing we got to do, Brittany, what's the first thing we got to do? You got to unmute your mic, Brittany.
I got 100 Fahrenheit minus 32 in parentheses times 5
First thing we got to, what the first thing we got to
divided
do,
by 9.
first thing we got to do is convert
Worth the parentheses.
Fahrenheit into what?
100.
You're kind of breaking up. I can't hear you.
I got 273.15 when I did that.
Okay, I'm not asking for numbers yet. I just want to know what's the first step. We first got to convert Fahrenheit into what?
To Celsius 32.
Okay. To Celsius. That's the first thing we got to do. In order to get from Fahrenheit to Kelvin, we got to first convert Fahrenheit into Celsius so we can add the 273 to it to get Kelvin, right? So 100 degrees Fahrenheit, this is how we got to find Celsius. So Celsius equals, we said the formula for Celsius is 5 over 9, right? Which is 0.55, right? Times what? Well, Fahrenheit minus 32. Yeah, so Fahrenheit, which is 100. So 100 minus 32. Now, is that in? That's not in. Yeah, it is in parentheses. It's in parentheses. So we got to do this first. So 100 minus 32 is what? So 0.55 times what? 68. right? We got to do this first, 68. Then the 68 times 0.55 gives us what? How much? 37.4 Celsius, right? 37.4 Celsius. Now we can take this and do up this, right? So Kelvin equals what Celsius? 37.4 plus what? 273 gives you how much?
310.4.
310.4. Or you can just say 310. That's fine. Okay, that's how you do it. Degrees Kelvin. So those are this is just basic stuff. This ain't even really respiratory level math, guys. You know what I'm saying? This is stuff this high school stuff here. Just Celsius and Fahrenheit is old school stuff. Just a reminder for you because you will deal with body temperature. Okay. You okay?
Oh, yeah.
Okay. So this body temperature, because a lot of patients are either febrile, which means they have a fever, or afebrile means without fever. That's some of the stuff we're getting ready to learn now as far as terminology. You got to know this. This is all works together when you're assessing a patient. Okay. All about assessment. Assessment. From the moment you walk into the room to the minute you leave the room, you're always assessing your patient, how they're breathing, their color, their pallor, right? All of those, you ask subjective questions, running diagnostics. All of this runs together, right? This is what you're going to be doing in the hospital. All right, so that is our temperature stuff as far as our Fahrenheit, Celsius, and Kelvin. You'll need to know definitely what normal body temperature is because it's going to make a difference in the alveolar gas pressure, depends on the temperature, okay? When you get to gas laws and physics, we're going to be talking about that, all right? So let's back up on the one that we skipped because also we're going to be talking about a lot of inches and centimeters. All right, inches and centimeters. We're going to talk about how long the trachea is. And that answer may come as inches. It may be written in centimeters. You got to know the difference between the two. Patient's body weight will either be in kilograms or pounds. You got to know how to convert those. All right, so let's take a look. All right, here we go. So let me go back up to just these basics. One here. Talked about this. Okay, temperatures. All right, now pressure. Oh, it's dry. And there's water here. If anybody wants some water, you can have some water. I usually keep them full. All right. Now, pressure. Pressure is very important. Make sure you put a star by the word pressure because pressure is what the body is about. Gas and fluid moves because of a difference in pressure. All right. You have to have a difference in pressure in order for gas to move in and out of the lungs. You have to have a difference in pressure in order for the blood to circulate through the body. Okay, pressure is very, very, very important to your profession. You have to understand the pressures. Okay. Now, we measure pressure in two different measurements. One is called centimeters of water, and the other one is millimeters of mercury. Centimeters of water, which is cmH2O, and the other one is in millimeters of mercury, which is mmHg. For instance, you can write this down. Most pressure measurements inside the body, pressures that are produced inside the body are measured in millimeters of mercury. Most pressures inside the body are measured in millimeters of mercury, such as blood pressure. What's the normal blood pressure? 120/80 millimeters of mercury. Okay. millimeters of mercury. A lot of people didn't know or don't know what the unit of measure. They just know 120/80, but 120/80 what? Centimeters, inches, what is it? It's millimeters of mercury. Okay. Centimeters of water usually are the pressures that we introduce into the body. Like somebody who has sleep apnea may sleep on a CPAP machine, and we give them a certain pressure, right? 8, 10, 15. Those pressures are written as centimeters of water. Okay, so outside the body that's being introduced is usually centimeters of water, and the pressures that are produced inside the body are usually millimeters of mercury. Okay, so we said the blood pressure, normal blood pressure is 120/80 millimeters of mercury. Okay, millimeters of mercury. Pulmonary artery pressure, which is the pressure inside of your pulmonary artery, is in
Mr. McCarthy, what was the pressure again for normal blood pressure?
120/80.
Thank you.
Normal blood pressure is 120/80 millimeters of mercury. What I want y'all to take away from this now is the unit of measure. Okay, millimeters of mercury and pressures, centimeters of water. So if I say, when you get a question, say, what are the two pressure units or two units of measure for pressure? You need to know centimeters of water, and the other one is millimeters of mercury. Okay, millimeters of mercury are written as mmHg. Centimeters of water are written as CmH2O. Okay. All right. Now, some of the prefixes, you can go back and look at these. This is how you kind of move your decimal, right? Talking about kilo, hecto, deca, deci, centi, milli, and micro. This is how you move your decimal. Now, I'm not going to ask you to memorize all of these. You don't have to memorize these, okay? You don't have to remember that's 1.0 times 10 to the 3 and all. You don't have to remember all of that. This is just showing you the movement of the decimal. But what I do want you to see is converting your decimal from a percent to a decimal, going from a percent to a decimal and back. You got to know how to do that, because when we factor in some of our formulas, sometimes the question may be in a percent, and you got to convert that to a decimal in order to work the problem out. Okay, so we'll see how much you know as far as that's concerned. If I'm going from, say I want to go from percent to a decimal. So percent to a decimal, right? So for instance, if I have 85%, what is that as a decimal? 0.85, right? You move the decimal 2 places to the left, right? So 1, 2, boom, equals 0.85. Whenever I go from percent to a decimal, I move the decimal place 2 places to the left, right? This is a review from middle school, right? Okay, but a lot of times people forget, because only 3 classes ago, you guys couldn't use calculator. RT210 was not, you could not use a calculator. You had to do it all by hand, because the board exam made you do it by hand. You couldn't use calculators on the NBRC test, right? But now they changed it to let students use a calculator on the exam at the NBRC. So Concord said, okay, well, if they can do it there, we'll let them do it here. But that's subject to change. They may say, you know, now it's getting kind of watered down with the professionalism and the accuracy of the therapist. Once the NBRC or AARC notices that, they'll say, oh, take them calculators away. They're going to have to learn it the hard way and get that caliber of student back up, okay? So for right now, you can use a calculator, but you need to know that. For instance, when I do a problem, if I'm doing the amount of oxygen that's combined with the hemoglobin, I got to know how to convert that, okay? Because it's going to be, you don't have to write this down, but combined with the hemoglobin, oxygen is hemoglobin times 1.34 times the SAT, right? That SAT is what you see on the board or on the monitor, somebody's oxygen SAT, right? The little probe that they give you, put on your finger, it reads a percentage. So if that person is 85%, when I factor that in the problem, I have to change it from percent to decimal in order to figure it out, okay? If I don't know how to do that, I'm gonna get it wrong, okay? Very important that you know how to do that. All right, so percent to a decimal, you move places, 2 places to the rest. So move decimal 2 places to the left. In case you forgot. All right. Now, linear, of course, 12 inches is a foot, 3 feet being a yard. We don't use feet or yards much at all with respiratory, okay? But we do, you do need to know how to convert inches into centimeters, which we'll show you that here in a minute as well. Of course, weight, 16 ounces is a pound. We don't really use that much at all. The volume as far as fluid is concerned, we don't use that. We don't use 32 ounces as a quart and 4 quarts as a gallon. You know that, but we don't use that in respiratory, okay? Now, we do use this. When we're talking about linear, we're talking about how long something is. We might want to know how long the trachea is, okay? The patient's trachea. All right, so for instance, this is a model of lungs and a trachea. This is the patient's trachea going all the way up to their thyroid cartilage, which is the Adam's apple, right? Then the thyroid here, but this thing here with the rings on it, that's the trachea. All of this is the trachea, and it's a certain amount. Anatomically, it's a certain length, which we'll learn when we get to pulmonary A and P, okay? Of course, this also has a model of the heart inside of it as well, right? And it talks about the valves and the chambers. When we get to cardiac A and P, you guys are going to memorize all of the valves and the chambers of the heart and how the blood flows through it. Goes to this chamber, goes through this valve, into this chamber, then to this valve, to this chamber. You're going to know it by heart when we do that. But when we're talking about linear, I might be talking about the trachea, right? And how long it is. So the answer choices might be in either inches or centimeters. So don't just stick to, oh, it's only 10 to 12 inches, so I know that, right? You got to know how to convert because the answer choices may be either or, all right? So for instance, to convert inches into centimeters, 1 inch is 2.54 centimeters. One inch is 2.54 centimeters. So if I said that something was 3 inches long, then how many centimeters is that? Sounds about right. So 2.54 times 3, right? 3 inches is 7.62 centimeters. Okay, really simple. But you got to know how to do it. You got to know that number, 2.54, because if you forget it, then you don't know how to convert. All right. So if we start talking about how long the trachea is or how long the lungs are or anything like that, you got to be able to convert from centimeters over to inches or inches to centimeters. What if I said that something was 18 centimeters and I want to know how many inches is that? How many inches is 18 centimeters? Write that in the chat. Don't say it out loud.
How many centimeters is what?
18 inches is how many centimeters? Write it in the chat to me. 18 centimeters is how many inches? I just put it in the chat for you. 18 centimeters is how many inches? Good, Charisma.
Oh, I read mine wrong. I'll have to do it again.
Okay. Good, Kelsey. Good, Courtney. And gotta look at it again, Brittany. 18 centimeters is how many inches? Good, Heather. Good, Stephanie. Good, Cassidy. Make sure you guys are writing your text to me, because if you write to everyone, then everybody sees your answer. If I say good, then they know that's the answer, and they may not know it. I want to make sure everybody knows it or don't know it. So the answer is 7 inches. If I'm going from centimeters to inches, I got to divide, guys. To go from inches to centimeters, you multiply, right? 1 inch is 2.5 centimeters. So 3 inches will be 3 times 2.54. But if I'm starting with centimeters and I want to go down to inches, then I got to divide. The opposite of multiplication is divide. So 18 centimeters will be 18 divided by 2.54, which gives you 7 inches, right? So the question may be anyway. It may say, okay, the patient's trachea was 15 centimeters long. How many is that in inches? You got to know how to go both ways, all right? You got to know how to go both ways. Can't be something that you just memorize. You have to expect the detour, okay? They're going to give you curved balls, I promise you. And you got to know how to work around them. If you know it, you have no problem. But if you're memorizing, then you will come across a problem, right? It's like a computer. You can teach a computer to do A, B, and C, but if D pop in, the computer don't know what to do. It just know A, B, and C, right? You have to think critically to move around it. All right, now kilogram. Kilogram is very, very important, because in the hospital, a lot of times they use weight in kilos, okay? You have a lot of formulas that use weight, and it's in kilograms, and the question might be in pounds. You got to be able to convert those pounds into kilograms and kilograms into pounds, okay? Very important. So for instance, 1 kilogram is 2.2 pounds. All right, 1 kilogram is 2.2 pounds. So if they say Mr. Johnson presented to the ED, Mr. Johnson presented to the ED with shortness of breath. They got his weight. He was 98 kilograms. How many pounds is that? I didn't calculate. It's probably right. This is what I'm going to show you. 2 things I'm going to show you right quick. So everybody look up here. This is what I'm getting ready to do some critical thinking with you right quick. VT is tidal volume. You see that, Michaelin? You see it, Brittany and Diamond? Y'all see it?
Yeah, I see it.
Okay, cool.
Yeah, I see it.
VT equals tidal volume. That's the normal amount of gas that you move in and out of your lungs sitting here right now. When you breathe in and out, that's about 500 milliliters of volume that's moving. The normal tidal volume is about 500 milliliters, okay? Now, to guess what somebody's tidal volume is, there's a formula for that, okay? To find tidal volume equals 3 cc's per pound. Remember, cc's and milliliters are exactly the same thing. cc's equal mLs. That's the same thing. I always remember that. It might be in mLs, it might be in cc's, but that's the exact same thing. So they're used interchangeably, all day long. So the formula to find tidal volume is 3 cc's for every pound of weight. All right. What if I tell you that Mr. Johnson is, let's just say Mr. Smith is 85 kilograms. I want to know what is his tidal volume. This is the formula to find tidal volume. But I gave you this is the problem. Mr. Smith is 85 kilograms. Mr. Smith is 85 kilograms. What is his expected tidal volume? What do I expect his tidal volume to be? Put it in the chat privately to me. It says to me, it's an option that says to me instead of to everybody.
I think it's like, I don't know. I shoot that.
Yeah, said because you should all of it should always become a destination.
I don't know if it's right, but the way I do it, I don't know.
That's what I want to know. Mr. Smith is 85 kilograms. I want you to tell me how much tidal volume do I expect him to have if the formula for tidal volume is 3 cc's for every pound. So you're going to have to turn this into pounds and multiply by 3. Okay? So let's see what we got. Somebody with 561, what you get? What you get?
I got 62, and I did the same thing that y'all just
62.
said. I did 85.
How
I
did-
did 85 times 2.2.
Gives you what?
187,
And then you gotta
Multiply by 3.
Oh,
everything
times it, I
is a
divided it by 3.
No,
You gotta multiply. 'Cause you
the
doing
formula is 3
everything.
cc's per pound.
Okay.
3 cc's per pound. Yeah, that's not a divide. That's a per pound.
Okay.
All right, good. I see a lot of 561s. That's how you do that. See, this is why we have to know how to do this, guys, because his tidal volume is about 560. That tells me where I start when I put him on a ventilator or some type of ventilation issue, right? I need to know where to start. I can't just guess. I need to know where to start, right? And so if I don't know how to do this, then I don't know where to start for my patient's therapy, okay? That's very important to be able to do that. All right, what about this one? What if,
So it was 561.
yes,
Okay.
what if Mr. Smith, so we're going to put some things together that we've learned. Mr. Smith presented to the ED with a 39 degrees Celsius temperature. He is short of breath. He weighs 102 kilograms. And I want to know a couple of things. First thing I want to know is what is his temperature in Fahrenheit? And what is his expected tidal volume? If I can put it up on the. Hold on 1 second. Hey. There we go.
I think I got it. I don't know yet. Yeah, I think I got it. I think I got it. Do I need to put it on?
I haven't worked it out. Let me work it out right quick.
My problem gonna be remembering the formulas in my head. Like if I'm seeing it in front of me, I can do it, but I got.
That's why you need a formula sheet. I also want y'all to make a piece of paper with formulas. Anytime I give you a new formula, put that formula on that paper, no matter where it is throughout the program. All your formulas need to go on a certain section of your notes. That way you can always go back. The formula for this is this. The formula for that is that. I also have a formula sheet that I'm going to give y'all probably tomorrow. I'll email it out tomorrow. I don't have another one here, but it's got all the formulas for all of RT. All right. Not just 210, but that's how you keep up with your formulas. All right. So put them in the chat and then we'll see what we got. I got one that says 102. And then 673 tidal volume. All right, well, let's see.
Yeah, that's what I got.
First, we got to do Fahrenheit. Fahrenheit equals 9/5, which is 1.8 times Celsius, which is 39 plus 32, 102.2. Good. 102.2 degrees Fahrenheit. Excellent. All right. So he's febrile. Okay. He got a fever. It's febrile. We're going to learn those words, but he's febrile. Right. So now I want to know, what do I expect his tidal volume to be? Well, he's 102 kilograms. So first we need to make that into pounds. So 102 times 2.2 is 224.4. So 224.4 times 3. Times 3 is 673.2. So tidal volume should be 673.2 cc's or milliliters. Either one. It's fine. Okay?
But you said we get that to be 102 times 2.2.
Yes, you got to convert. Remember the formula for
times 3.
yes, because the formula for tidal volume is 3 cc's per pound. Okay.
You gotta do the weight formula for that one.
Yeah, you got to
Convert it.
yeah, you can't put the 102 in there because you need to know what that is in pounds, right? All right. So that's how you see how we added a couple of things. That was just 2 things that we've learned. They get longer than that. The questions become paragraphs. We call them case studies. You go and find out the information or the history and physical of a patient. You go see his whole paragraph. And then you can see, how do I want to arrange his therapy? How do I want to take care of Mr. Smith? I'm going to take care of him. I'm going to give him this, give him this medicine, that medicine. I'm going to start him on this treatment, this therapy, and you do it all, okay? You do it all. It's not just taking his blood pressure and his temperature and going on to the next patient. You are doing actual medicine, okay? All right. So let's continue on. We got to get into these terminologies. So the most important ones, guys, that I've been telling you, make sure you know how to do this one. The linear, the 1 inch is 2.5 centimeters, 2.54. Make sure you know this kilogram goes as 1 kilogram is 2.2 pounds. If I have pounds and want to go to kilograms, I got to divide, right? The opposite is to divide. Make sure you know your temps. Okay. Now, let's look at some of these words. Root words. Okay, we'll look at some root words, and then we'll go into some prefixes and suffixes. Root words. Gastra is the stomach, right? Gastro would be stomach issues, right? Cardio is what? Heart. Dermal is what? Skin. Pneumo is air. Plural is the lung lining. Trachea is the hole that you put in somebody's neck. This is a trachea. This is a trachea here, okay? This is a patient, this cross-section of a patient, and this is a trachea. This is where you put a hole into his trachea, all right? We all have a trachea, and it's, I forgot the exact length. We'll learn it when we learn the length, but the trachea is made up of C-shaped rings all the way down, and there's one that goes all the way around. You'll learn about that. When we do a tracheostomy or tracheotomy, we're cutting into the patient's trachea. That's what happened with this patient. They're no longer able to breathe through the mouth or the nose. We have to put a trachea in, okay? So this will be a tracheostomy, right? And we will put this tracheostomy into their trachea, okay? It just goes right into the airway, just like that. This is going to be the site of a lot of secretions and real foul smelling sputum. If you can't deal with that, you need to get out now, okay? Because you're going to see that a whole lot of that. A lot of it is bacteria, Pseudomonas, things like that. You'll smell it when you hit the room, okay? Got a distinct smell, okay? And also, weaning to death. A lot of students didn't know that a lot of times you as a therapist have to wean somebody to death, all right? If you're not able to do that, you're in the wrong field, okay? Whether it be a child or an adult. If the family says, we're done, we're not going to try anymore, you got to go in and take the tube out of his throat, turn the machine off, and watch the patient die, okay? That's going to be what you're going to have to do in your career. Now, if you're like, oh, I can't do that, well, then you need to change positions right now, okay? Because you're going to have to, okay? Sometimes you can't save them all. Always remember that. You will not be able to save them all, especially if you decide to work with peds. If you're working with pediatric patients, you're going to be weaning pediatric patients to death, okay? So a lot of cute little 5-year-old boy or girl who was so happy when you first met them and got these turned to the worst, and the family says, we're done crying about it, we're going to just give up and let them go, then you got to, if you're on shift that night, you got to go in there and turn them off and watch the little boy die, okay? It's life. If you can't deal with that, you need to change professions, okay? It comes with the territory. Now, it's also rewarding when you have somebody who's close to death and you gave them respiratory therapy and monitored his vents and got them back talking and walking around laughing. It's more rewarding than it is scary, okay? But you will have to do that, all right, in your career. So I just want to make sure you get that out there before we go any farther. Now, so you're going to have a lot of secretions and yellow, thick secretions that pop up all around the throat, and it stinks real bad. You have to suction, and a lot of people can't deal with that. I don't like feces and vomit, so I don't do nursing. A lot of nurses can't deal with sputum. They can deal with the boo-boo and the throw up, but they just can't deal with this, and they just can't do it. So, you know, it's respiratory is for the respiratory therapist, okay? All right. So if we're looking at our words, abdominal. Abdominal is your abdomen, right? Abdomen. Adeno will be the glands. Hemo means what? Blood. Costo means ribs. The costals. The costals are the ribs. Cyto is what? Cells. Vaso, the vessels. Bio, study of life, right? All right, then you have the thorax. The thorax is the chest area, the ribs that encompass the whole top part, that's the thorax. Bronchio is the bronchus. Bronchio, the bronchus. Now, your trachea bifurcates into two main stem bronchi, right? Left and right main stem bronchus. Looks like this. If this is the trachea, right? This is the trachea. marker's going out a little bit. This is the trachea. This is the trachea here. It's got the little rings on it. All right. Now, the trachea bifurcates into two main stem bronchus. This is the left bronchus, and this is the right. I'm sorry, damn. This is the right, and this is the left. Okay, now remember this, guys. When we're dealing with position, we're talking about the patient's right and left, not your right and left. Not your right and left, but the patient's right and the patient's left. So if this is the patient, this is me, right? This is my right, this is my left, okay? So when you're talking about somebody's lung or whatever, if you're talking about his left lung, don't be over here talking about it, well, it's the left. No, it's his left, all right, and his right, okay? So the trachea bifurcates into two main stem bronchus, the right main stem bronchus and the left, right? And it bifurcates at a special place called the carina. We'll learn that when we get to pulmonary A and P. But that's just wanted to show you that right quick because we're talking about bronchus. That's what I mean by bronchus, right? A bronchio, right? Bronchio are these two here, okay? All right. Now, what about myo muscle? Myo. Now, don't get it. Don't misunderstand myo and myco. Myco is fungus. Okay. Myco is fungus, and myo is muscle. Yes, myocardium is the heart muscle, right? And myco, like mycofungin and stuff like that, that's dealing with fungus. What about cyano? Blue. Cyano means blue. Febrile means fever. So if somebody's temperature is 39 degrees Celsius, then they are febrile. Because what's the normal body temperature in Celsius? Huh? Spanish for blue. What's the Spanish word for blue? I think it's Spanish. Is it Spanish? Or is it a, yeah. Cyan means blue. Okay. So cyanosis or cyano means blue color. Patient he's blue. If somebody's drowning or lack of oxygen, they are turning blue. All right. Yeah. So cyan means blue. Cyano means blue color, right? Patient is exhibiting blue color, and that's because of a lack of oxygen. When you are hypoxic, you turn blue, okay? When a body has a lack of oxygen, they turn blue, okay? Febrile means fever, okay? Febrile means fever. Somebody has a temperature that's greater than 37 degrees Celsius, they are febrile because the normal body temperature is 37 degrees Celsius, right? All right, aerobic. What's aerobic mean? In the presence of oxygen. And people that was online, y'all can speak up at any time when I'm asking these questions. Come on in and say it, okay? You can feel free to say it as we go. All right, now prefixes. Now these are important because we're going to put some of these prefixes on some of these root words and may change the meaning, okay? So look at the first one. A and an is a negative prefix. It means away. It means not away, but it means not or without, okay? A or an. So for instance, anaerobic means without oxygen. Aerobic is with oxygen and anaerobic is without oxygen, okay? Everybody understand that? When I put a or an at the beginning of a word, I'm talking about without now, okay? Ab, it would be away. Di would be to, right? Ex would be out of. These next three are very important. Intra is what?
Inside.
Inside. Infra is
Yeah.
Beneath.
beneath.
Oh,
Infra would be like infrared color. That's colors that's under the spectrum that you can't see. Inter is in between. Okay. That's important because we have three types of fluid in the body. There are three types of fluid in the body. I want y'all to write these down. Three types of fluid in the body and where they are found. You want to have to answer this question on your oral exam and tests and everywhere. Okay, you need to know this. Intracellular is inside the cell. Intravascular.
Mr. McCarthy, we can't see you.
Okay. Oh. All right. Intracellular is inside the cell. These are three types of fluid in the body. Intracellular is inside the cell. Intravascular is inside the vessel, right? Like your arteries and veins, okay? And then not intra, but interstitial is in between the cells. It's in between the cells. Intracellular, inside the cell. Intravascular, inside the vessel. And interstitial is in between the cells. You're going to have to memorize that one because there will be questions on your oral to say, what are the three types of fluid in the body and where are they found? You're going to say, oh, intercellular, inside the cell. Intravascular is inside the vessels, and interstitial is in between the cells. Okay? Three types of fluid and where they're found in the body. All right, so that's your, let's keep on going. Macro means large. Mal would mean abnormal, right? Like malnourished. If somebody is malnourished, they look like they're sick, right? They look like they're not getting enough nourishments. And then mega is large. Macro and mega both are large. What about micro? Small. What about neo?
New.
New. So what's a word that we might use with neo that means new? Neonatal.
Neonatal.
Good. Neonatal for your newborn babies, right? Or early premature babies. Ortho means to correct. Sub also means below. Trans would be through, right? Contra is against, like a contraindication. When we give medicines, we have indications, which are reasons we give the medicine, and contraindications will be reasons why we wouldn't do it. The reasons why we are against giving it, right? Contraindications, like not being able to swim is a contraindication to getting in the pool, right? You can't swim, we advise against it, okay? Hyper, now these are some other ones that you need to know for sure. These are, you're gonna see these a lot. Hyper, hypo, it won't let me do. Hyper is above or too much. Hypo is below the normal levels. Right? When we say above and below, we're talking about normal value. Okay. Hyper means above the normal value. Hypo will be below the normal value. Tachy means faster than the normal value. And Brady means slower than the normal value. Okay? For instance, let's look at putting them together. If somebody's heart is beating really fast, that would be tachycardia, right? Tachycardia, because cardia means what? Heart.
Heart.
Yeah, cardio is heart. So if somebody's heart is beating faster than it should, we call that tachycardia. If somebody's heart is beating slower than it should, that's bradycardia. Brady means slow. Okay? Bradycardia means slow. Okay? Hyper and hypo. We think about that in ventilation. Somebody is breathing real deep and real hard. They're hyperventilating. They're ventilating too fast, right? Now, that's also close to tachypnea, okay? So hyperventilation and tachypnea are kind of the same because apnea is breathing, right? Let me see if I find it up here. Did I tell y'all that yet? Let's see here. Oh, it's right here. Pena. Pena is breathing. Everybody look right here. Pena is breathing, right? So Brady Pena is breathing slow. Tachypnea, right? Tachypnea. So that's tachypnea is fast breathing. Okay, that's how that works. You will see these a lot as far as the hyper, hypo, tachy, and Brady. Okay, when we talk about the heart, we're talking about it being faster than it should. The normal heart rate is 60 to 100. So if somebody's heart rate is 120, they're tachycardic. Okay. Well, BI is 2. Yeah, BI could be twice a day. And that's probably why they left it out. Retro is behind. Right? Retro is behind.
AB is adding.
A what?
Adding to
AB?
AB as in dog.
I'll look into it. Don't worry, it's not on the test. I don't know why they threw those on there. Don't worry about those. But retro is behind. So if somebody has retrosternal pain, that's pain behind his sternum, okay? Retro Leo or retro, my eyes are hurting behind my eyes. That'd be retroretinal or something like that, okay? That's all that means. Retro means behind. I want you to understand, though, this hyper, hypo, tachy, and Brady. You need to understand those. Hyperventilation, because what I told you, we'll learn a little bit later, but the AKAs, Mr. McCarthy, AKAs, ventilation and all of that. If I'm hyperventilating, I'm blowing off too much carbon monoxide because they're the same. Ventilation is carbon monoxide. It is respiratory. It is an acid, right? So if I'm hyperventilating, I'm blowing off too much carbon dioxide. Ventilation, carbon dioxide, the same thing, right? That's why I teach you those AKAs early. Make sure you go over those things tonight, guys. Go over go over those AKAs that I got you so you can lock them in your head about those AKAs. And also about your bicarb. Bicarb is your base. It's also your metabolism, also your alkalosis. So you need to understand those. And also, don't forget, oxygenation and ventilation are not the same. They're two different things. Okay, we're going to be harping on that the whole 210. All right, let's look at some suffixes. Algia. Oh, somebody needs to mute their mic. If you're not talking, mute your mic. All right, I think I just did. I think it was Brittany's. I did it for you. All right. Algia is pain, right? If algia is at the end of a word, they're talking about pain, okay? Ectomy is removal, right? A lobectomy, when they remove a lobe from the lung, okay? Gen is an agent. Oma will be a tumor, like lymphoma, right? Is a tumor. Pena is lack. Okay, pena is lack. Ostomy. Now, this is where people get confused. Ostomy and otomy are two different things. The otomy is the actual hole. Okay? The otomy is the hole in the trachea, right? Or wherever it is. An otomy is the hole. Ostomy. The ostomy is the hole. So strike that, guys. The ostomy, O-S-T-O-M-Y, is the actual hole. Okay? The ostomy is the hole. You're looking at a person's tracheotomy. Ostomy, okay? Tracheostomy is what you're looking at. The hole. If I cut a hole in your throat, that hole itself is called the ostomy. Ostomy. Okay, that's the opening. Now, to get that open, I have to cut, right? And the cutting is called the otomy. All right. So ostomy and otomy are two different things. You'll see that on a test, and a lot of people get them mixed up. But ostomy is the hole, and otomy is the actual cutting. Okay. If I do a tracheotomy, I'm cutting a hole in your trachea. If I say something about a tracheostomy, that's the actual hole that's already in your trachea. Okay. Itis. Itis would be inflammation, right? Like arthritis, inflammation. Anytime you add itis to something, that means it's inflamed. Okay. Pleuritis would be inflammation of the lung lining, right? If we look at pleural, look right here. Number E, look at E. Pleural is the lung lining. So if somebody has pleuritis, then that's inflammation of the lung lining, okay? Dermatitis is inflammation of the skin, right? Carditis, what about carditis? Inflammation of the heart, right? Depending on which one it is. Is it endocarditis, myocarditis, right? It just depends. We'll learn that when we get to A and P of the heart. So itis means inflammation. What about ology? Study of. Ology is just like biology, is the study of life. All right, gram is a tracing. We do that a lot of times, gram tracings on different bacteria and viruses. Grav, of course, is a record, and pena. Pena is breathing. Pena is breathing. All right, so let's put some stuff together. It's a quick one. A tracheostomy is the tracheal opening, right? Because ostomy is the hole, the opening. Tracheotomy is the tracheal surgery. Me actually cutting your trachea is a tracheotomy. All right. Adenoma is a tumor in your glands. Adenoma will be a tumor, a gland tumor. Pleuralgia is pleural pain. Pain in your pleural area. Not necessarily, but these are just, these are put them together. You need to know how to put them together. Bronchitis, inflammation of the what? Bronchi. Inflammation of the bronchi. Tachypnea, fast breathing. Everybody say tachypnea. Yeah, it's not tachypnea, it's tachypnea. Tachypnea means fast breathing. All right. When you're talking about somebody in a hospital, you're not gonna say, well, he was breathing real fast. You would say he's showing signs of tachypnea, right? He's tachypnic. All right. That's what you would say. Bradycardia is heart rate less than 60 beats per minute. The normal heart rate, guys, is 60 to 100. That's the normal heart rate. 60 to 100 beats per minute. That's normal. If it's less than 60, it's bradycardic, right? Bradycardia. If it's greater than 100, it's what? No, that's breathing. Heart rate greater than 100 is
Tachycardia.
Tachycardia, good. Tachycardia. Then we have hypertrophy. Hypertrophy is increase in size, overdeveloped, right? If somebody's heart is getting bigger than it should be, that's called hypertrophy. It's working harder than it should. Anytime you work a muscle really, really hard, it's going to start getting bigger and bigger, right? And so if the heart has to work harder than it should, it starts to get bigger. It's a muscle, and that's called hypertrophy. And then finally, atrophy. Atrophy means wasting away. Somebody's just their muscles are just wasting away. They're getting smaller and smaller, just atrophy, right? Atrophy. All right, so what we talked about, hyperventilation and tachypnea. They're kind of very close, all right? But ventilation would be more the amount, right? Because we talk about ventilation is CO2, right? So the amount of gas that they're breathing in, because they can be hyperventilating and having big breaths, not necessarily really, really fast, but very large breaths. It's more the amount than the speed. So hyperventilation is more of a breathing off too much CO2 than it is how fast they're doing it. Tachypnea simply means they're breathing a little faster than they should, okay? Because they could be breathing real shallow, but faster. That's still considered tachypnea, okay? But when they're breathing off too much CO2 and they're gasping, that's hyperventilating, okay? They're kind of close, but they're a little bit different. So think of hyperventilation with CO2. Hyperventilation or ventilation is CO2, right? AKA CO2, AKA acid, AKA capnia, AKA carbia, right? You're going to see that all day long throughout this whole thing because that's your friend. CO2 is your friend. You got to control him. If you can control him, you can control your patient, okay? All right. Now, tomorrow, we're going to get into the directional terms, and then we'll be talking about some more abbreviations, start getting into the ethics, right? And that'll be the end of pretty much we'll review a little bit and start getting prepared for the exam. But that's enough for today. Tomorrow, we'll come in at 1 o'clock, and we will start talking about directional terms, which are, some of them are a little bit difficult to remember, but for the most part, that's it. Tonight's homework would be RT210A number 1. I just want you to do homework number 1 for tonight. I'm going to put it in the module. You will see it. It'll say homework, RT210A number 1, and under that is going to have a date. It's going to be due tonight. It's going to have today's date, 1/4/21. It's due by midnight, okay? That will be your homework and your attendance for today. So don't forget, even if you are here right now, you are not present if you don't do that homework, okay? So knock it out, upload it. All you got to do is select it and then follow the steps to upload it, okay? You will upload it to the Canvas. And that will
so we can take a picture of it.
Yes, you do it, take a picture of it and upload it. You're going to upload it on Canvas. Yeah, upload it on Canvas. So you'll go to it like this. You're going to see it. Right now, you don't see it, but I'm going to put it in. It's going to be in this module, RT210A Measuring Technology. Terminology. You're going to go to it, select the homework when I put it in, and then it's going to follow the steps to upload it. Okay, it's going to let you upload it, and you have till midnight to upload it. After midnight, it won't accept it. Okay, you're absent for today. All right, and at night.
I have a question.
Yes.
On Wednesday, it says exam and review, so we have to come to campus.
Anywhere you see exam or if you see lab, you are here on campus at your scheduled time for your team.
All right, so Wednesday, okay.
Whatever group you're in, that's what time you come on that Wednesday.
So for homework 1, will it be in the, we'll find it in the book?
No, it's in the homework packet that you have.
Well, I mean, like the answers will be in the book?
Or the answers will be in the reading and the lecture that you just got today.
Okay.
Yep, it'll be in there.
And for the homework on the syllabus, it says 1, 2, 3, 4, and 5. So we have to have those completed by the end of the week.
No, you're only going to do the homeworks that I assign the days that I assign. You're not always going to do all of them. You're only going to do the ones I give daily. Okay.
Oh, okay, okay.
So go back and watch the lecture that you missed this morning or today, so you can, because I went over a lot of stuff about the syllabus and the homework. And if you just came in a little late, then you probably missed that. So I'm about to load the homework and the lecture by a few hours from now, because it takes a little while for the lecture to load. But once the lecture is in there, you can go back and look at the part that you missed, so you can hear all the stuff that you missed about the syllabus and stuff. Okay.
Okay.
All right.
Mr. McCarthy,
Yes.
it's 2 pages to this homework assignment, right?
Homework A,
Uh-huh.
front and back. Yeah. You just put 2 files. It'll let you load 2 files. This is
And
homework
where will we find the answers to the second page where it say electronic charting?
in the book, in some of the reading.
Okay.
Yes,
Okay.
the reading, do the best you can. Yeah, I'm not really worried about the back as far as the, you can see some stuff about charting. It's not, it doesn't have to be completely accurate on that electronic charting yet. The main thing I'm worried about is the front.
Okay.
So
Okay.
whatever you find on the back is fine. But if you get just the front done, that I'll give you credit for that. Okay.
Okay. Thank you.
Homework number 1, RT, it says right in the corner, RT210A number 1. This was due tonight. So you don't have to do 2, 3, and 4, none of that. You just do the ones I give. Sometimes I give them all, sometimes I don't. Sometimes I give something totally different. So whatever I give each day is what's due for you that day. So make sure you watch the lecture. So there won't be anything you can just go ahead and knock out some stuff and be back and catch up later. You can't do that. It's gonna be a daily involvement, participation, and homework daily. Okay, it may change. I may give something completely out the book. I may say do the key terms in chapter 2 and do those. Right. So you have to be here to know what I'm talking about. So just take it one day at a time. You're gonna be fine. All right. I'll see you guys tomorrow at 1 o'clock. Like I said, give me an hour or so to get that loaded up into today's lecture loaded up. It'll say live lecture 1/4/21. That's what it's going to say. And you can go back and look at it at any time. It's going to take you to YouTube when you select it. It's going to take you to my YouTube page because they're so big that it's hard to load them. And you'll see there, my YouTube page consists of all the lectures I've done on past classes. So you got plenty of information there. If you can, when you get farther down the road, if you want to go back and study and look at lectures, old lectures, they're there for you to watch. Okay. So I see you guys.
So tomorrow, will we be able to go in through the Zoom link, or will we be going in how we went in today?
You should have gone in through the Zoom link today. I know it was an issue today, but I changed the link. So most of y'all should have gotten in through the Canvas, the normal way. But if it don't work for you, just go in the same way you went today. It's the same link.
Okay.
All right.
Okay, one last question. To be clear, we do have to be on campus Wednesday at our assigned time.
Yes.
Okay, thank you.
All right. Okay, guys. So again, I'm about to put the homework in and the live lecture will be loaded. So look back around 6 o'clock. Everything should be in there for you to see. Okay, the homework and the live lecture to go back and look if you want to. Tomorrow, see you tomorrow at 1 o'clock. You need to email me tonight about coming tomorrow. If somebody wants to come to class tomorrow, you need to email me so I can tell you, yeah, I'm going to say yes or I'm full. Okay, so it's usually the first come, first serve. But don't start texting me now. Wait till start texting me around 8 o'clock. So I'll know. Give me some time to see, other people to look at the lecture, because they might not have been here, and that give them a chance to look at the lecture and decide whether they want to come or not. Okay, so many of y'all, I have to try to rotate you in as best as I can. Okay.
Okay, what book is the Egan's book? Because I don't see that one.
The Egan's is the biggest one, baby. It's the big purple one. It says Egan's Fundamentals of Respiratory Care. This one right here.
I don't think I have that one.
You should have it. That's the main book. I don't see them not giving you this one.
Okay, I should have it. I just have to go look for it. Okay.
Okay.
We got to read those chapters in that book tonight, right?
Yeah. Each segment, I mean each unit has a set amount of chapters to read in each book, right? This one happens to have Egan's chapter 2, 3, 4, 5, something like that. You can read as many as you can read for this unit. When we get to cardiac AMP, it's got its own chapters to read, right? Then we get to pulmonary AMP, it's got its own chapters to read. So you just follow along in the syllabus. All right, we are at let me go back to the syllabus. Yeah, that's the second book. Yes, you get all of the reading for each unit. Here it is right here, guys. For 210A, this is the assignment to read. 1, 2, 3, 5, 6, and 16 in the Egan's book, and chapters 1 and 2 in the CARC book. That's all of the reading for 210A. Okay, when we get to 210B right here, 210B, you'll be Egan's 10, 13, 16, 17, and 18. Then you got Seal's book, which is the orange and blue book, 1 and 11, and then CARC book 3, 4, 7, and 11. It's a lot of reading, right? Some of them are smaller though. Look at the next one. Pulmonary AMP 210C is only 9 and 16. Okay, but like I said, you don't have time to do anything else but this. It's a lot of information, but we are a proven unit, a proven system with 98% of our students go on and pass the board on the first exam. Seal's book is the you can ask them, it might be on back order, but I mean it ain't a whole lot in them anyway. That's it right there. It's a blue and yellow book. All right, guys, so that's it. I'll see you guys tomorrow. Like I said, wait till about 8 o'clock to start emailing me about wanting to come to class tomorrow. If you have any that want to come in actual class tomorrow, you can email me and I'll let you know yes or no. The first 9 people or if I have 11 people and the 2 that's here today, I will let the other 2 go if I have enough. I want to let them switch out as much as possible. So let me know around 8 and I'll let you know yes, or I'll say I'm full. If I say yes, that means you show up tomorrow. Now don't say you want to come and then you don't come because you're holding the spot back from somebody who might have wanted to come. All right, so if you want to come, then come. If not, then that's okay. You can be live or watch the lecture. Yeah, that's fine. All right, good day today, guys. A lot of information. I know we start working out bugs and kinks. It's okay. It's not a big deal. Nobody's behind or anything like that. Just relax. Look at the lecture. Do the homework. Be prepared for tomorrow. Okay? See you tomorrow.